All right, hi guys. A very good evening to all of you. Welcome to our today's live class session of INICET PYQ series. And in our today's session, we'll be discussing the important previous year questions of INICET. Previously, I think day before yesterday, we also had a class on INICET that was conducted on app. And in that class, what we actually discussed was the high yield topic from the test and discussion point of view, but this is going to be typical PYQs, the exact PYQs that were asked, we are going to cover, because this is one session here today. We'll be covering minimum of 3 papers which I'm trying to cover today. INICET ka what all question that was asked in the most recent examination, that is May 2025, then we'll go to the November 2024, and also we'll go to the May 2024. So we'll go from the most latest to the previous questions. So before I start the session today, please let me know if I'm clearly audible and visible to all of you guys. Is everything is all right? Audio, video, all good? Hi guys. Please let me know if everything is fine, if you can hear me clearly. Please let me know if everything is fine, if you can hear me clearly. I think in my phone everything is running good. Chalo, great. So let's get started with the most recent question that was asked May 2025. Now, what is the purpose of doing this entire PYQ series? So that you can actually understand what is the mindset of examiner, because the upcoming examination usually be having questions from almost similar topics. They are not going to be anywhere else. I mean, they're not going to be asked from anywhere else. They'll be mostly from these areas only. The first question that I'm going to discuss here is about a patient on anti-epileptic drug carbamazepine presented with ataxia. History reveals he was recently started on erythromycin. Now, please do remember, whenever I discuss general pharmacology, I always say that if one student is coming to me and saying, "Sir, which is one topic from general pharmacology that I should mainly read to make sure that I do not miss, at least if a very important topic is going to be asked," I always say read the drug interaction, especially the enzyme inducer, enzyme inhibitor. That is one of the very high yield topic, and examiner definitely asks questions from this enzyme inducer and enzyme inhibitor topic. So in this case scenario, if you see, the patient is having problem like ataxia, right, and other symptoms was also given. If you see, like confusion and a blurring of vision, other symptom may be also given. Do remember this. Carbamazepine, it's one of the anti-epileptic drug, AED, anti-epileptic drug. They are actually associated with the usual side effect that we always remember by the simple mnemonic of carbamates, that is confusion, ataxia, rashes, that is occurring mainly due to Stevens-Johnson syndrome, rashes which is occurring mainly due to Stevens-Johnson syndrome, right, blurring of vision, blurring of vision, then agranulocytosis, that is one of the dangerous side effect, agranulocytosis, that could be possibly due to bone marrow suppression, and this bone marrow suppression could even lead to aplastic anemia. Now, all these side effects that I have written here, boys and girls, remember, they are mostly associated with the carbamazepine. But there is one side effect which I am writing down here, that is called dilutional hyponatremia. This side effect, that is dilutional hyponatremia, has been asked previously in NEET PG and INICET a couple of times already. This particular side effect, dilutional hyponatremia, it is more common with the oxcarbazepine as compared to carbamazepine. Other side effect, if you see, like confusion, ataxia, rashes, blurring of vision, marrow suppression, these are more commonly seen with the carbamazepine. Carbamazepine will be more as compared to oxcarbazepine. Actually, oxcarbazepine has shown to actually increase more ADH from the posterior pituitary, and because of that there will be more and more dilutional hyponatremia that is associated with the oxcarbazepine. Now, coming to this question once again, I mean, this is another question. एक टॉपिक से मल्टीपल क्वेश्चन कैसे पूछे जाते हैं वो मैं आपको यहाँ क्लियर कर रहा हूँ कि व्हाट कुड बी द अदर क्वेश्चन. These are they have already asked this question. Now, this question is not about whether the side effect of carbamazepine is this or not. This question is mainly about a drug interaction, because he was started on another drug that is known as your erythromycin. Please do remember, erythromycin is a very potent enzyme inhibitors. Erythromycin is a very potent enzyme inhibitors. Now this enzyme inhibitor, always do remember, they will slow down the metabolism, and when they slow down the metabolism, what will happen? There will be increase in the toxicity of the drug. So erythromycin toxicity will not present with anything like this. They may have nausea, vomiting, and more commonly diarrhea. But in this case scenario, there will be carbamazepine toxicity, because confusion, ataxia, these are all the side effects of the carbamazepine. Worsening of the epileptic disorder and decreased action of carbamazepine, they are simply the dummy choices. Decreasing action of carbamazepine, no, right? If there is a decreased action of carbamazepine, there will be epilepsy का recurrence हो जाएगा. There will be recurrence of the epilepsy. Now to solve all the potential MCQ on this topic, which is very very potential topic for your examination, remember enzyme inducers and enzyme inhibitor का example, very very important. Inducers we have greaseprevir, an antifungal drug, phenytoin, rifampicin, smoking or St. John's wort, carbamazepine, phenobarbital, barbiturate and DDT. DDT is one of the pesticide. तो GPRS cell phone use करने से battery becomes dead. Yes, it get induced and it becomes dead. Example, if you have already seen this example, do remember most of the anti-epileptic drug, if you are going to see, like phenytoin, your St. John's wort is also having anti-epileptic property, carbamazepine, barbiturate, phenobarbital. These all agents that I have written here, they are all having enzyme induction property. So inducer, they are going to increase the rate of metabolism. So there will be rapid metabolism. There is going to be rapid metabolism. And because of the more rapid metabolism, there will be increase in the rapid metabolism मतलब rapid inactivation. So there will be increase in the risk of treatment failure. Whatever treatment that you are doing, उसके treatment का failure होने का risk क्या होता है, ज़्यादा हो जाएगा. A classical example that is always going to be asked is about a patient on oral contraceptive pill and she was started on anti-tubercular drug like let's say rifampicin. What is outcome? See, rifampicin is an enzyme inducer. They are going to increase the metabolism of OCP. OCP के metabolism को increase कर देंगे, and once the OCP metabolism is increased, do remember there will be actually contraceptive failure. Now this itself is another PYQ of NEET PG, that a patient on OCP was started on anti-tubercular drug. She was also asked to use an alternative method of contraception. What is the reason? Reason because rifampicin is a very very potent enzyme inducer. The reason is rifampicin is a very very potent enzyme inducer. Now what is the advice that is given to this patient? The advice that we are going to give to this patient is the patient has to use an alternative method of contraception. I always say the best advice is don't use two drugs that are going to show interaction. But examiner is actually already aware that even a normal person also knows, even a non-medico also know that if two drugs are having interaction, don't give them together. So let's ask what kind of dose adjustment or what kind of advice that will be given to a patient with an OCP and started on rifampicin. So she was advised to use an alternative method of contraception because rifampicin is a very very potent enzyme inducer. Okay, in this condition here, do remember that increasing the dose, that could also be one of the possibilities, right? Increasing the dose, that could also be one of the possibility. But OCP का dose बढ़ाने से there will be more side effect compared to effect. So increasing the dose can be one of the possibility also. So there are multiple things that you can do. Don't give them together. Use rifabutin in place of rifampicin, or increase the dose. Increasing the dose will be mainly utilized in any other drug interaction. For example, if there is let's say warfarin and warfarin का interaction अगर हो रहा है तो उसमें warfarin का dose usually हम बढ़ा देते हैं. तो it depends on the clinician actually कि what actually is the feasibility. Enzyme inhibitor example, see, peacock वाला आएगा inhibit करके जाएगा. Peacock वाला पे I always put more pressure because वाला is the valproate. Peacock वाला आएगा, repeat with me, inhibit करके जाएगा. So this peacock वाला is going to be enzyme inhibitors. HIV protease inhibitor, erythromycin, clarithromycin. So in this case scenario, what we saw in the previous case, that how carbamazepine toxicity was increased due to erythromycin. So erythromycin, clarithromycin, amiodarone, allopurinol, ciprofloxacin, omeprazole is one of the PPI, cimetidine, ketoconazole, valproate. Right, so they are going to slow down the metabolism, and because of the slowing down of the metabolism, there will be increase in the risk of toxicity. एक example तो I have already given you, example number 1, जो कि already I have given a case of carbamazepine with your erythromycin. This already we have covered in the case. Another example that I can give you, that let's say there is a patient who is on warfarin, and this patient was started on clarithromycin, or he started self-medicating, because clarithromycin is not a very commonly used antibiotic, he self-medicated, है ना. clarithromycin के कुछ specific uses ही हैं, like drug resistant leprosy, है ना, your H pylori, specific uses हैं इनके. So if there is going to be clarithromycin warfarin, what is the outcome expected? This clarithromycin is going to slow down the metabolism or inhibit the metabolism of warfarin, and because of this slowing down or inhibition of the metabolism of the warfarin, what is going to happen? There will be increase in the risk of warfarin toxicity. प्लीज माइंड द फैक्ट दैट वारफरिन टॉक्सिसिटी का रिस्क अगर जहाँ पे भी बढ़ेगा, देयर विल बी ब्लीडिंग, दिस विल बी मैनिफेस्टिंग विद द ब्लीडिंग, दिस इज गोइंग टू मैनिफेस्ट विद द ब्लीडिंग, ये ब्लीडिंग के साथ मैनिफेस्ट करेगा, राइट. सो ऐसे पेशेंट को ऐसे कंडीशन में क्या एडवाइस दोगे आप? द बेस्ट एडवाइस, एज यूजुअली आई सेड, इफ टू ड्रग्स आर हैविंग इंटरेक्शन, डोंट गिव देम टुगेदर. फॉर एग्जांपल, इफ वारफरिन कुड हैव इंटरेक्शन विद द क्लेरिथ्रोमाइसिन, द बेस्ट एडवाइस इज डोंट गिव क्लेरिथ्रोमाइसिन टू दिस पेशेंट. But other thing that you can do apart from that is you can reduce the dose of warfarin. So I think this is one of the very, very important topic, and do remember I have covered this in all ways, and you can solve all the upcoming questions from this topic. So this is a case of your carbamazepine toxicity. Which of the following pharmacokinetic parameter primarily determines the loading dose of a drug? Now from general pharma, one is enzyme inducer, enzyme inhibitor, and the formula, or sometimes they ask you to calculate, they give you the values and they ask you to calculate. In this question of May 2025, the most recent INICET, what are the factors that actually determines the loading dose? Now this is a multiple correct option wala question, like 1 2 3 4 are there. So volume of distribution, half life, plasma concentration, bioavailability, these are the 4. So 1 and 2 only, 1 2 3 only, then there is 2 and 4 only, 1 3 4 only. Who can tell me the answer? You guys please participate, because these are the PYQs, you must have seen these questions already. Manish Shukla is saying 1 3 4. Other students also please take part in this one. What or which pharmacokinetic parameter primarily determines the loading dose of a drug? Guys, if you are going to look at the loading dose, you can easily get the formula of loading dose with the help of the formula of volume of distribution. Volume of distribution is equal to drug given divided by the plasma concentration. How much is the drug dose given? That is going to be, how much is the drug dose given? That is actually going to be seen if you are going to give by IV route, है ना, ये IV का हो गया volume distribution. तो drug given, that is going to be your loading dose will be equal to volume of distribution into plasma concentration. All right. Now look at this. If there is going to be loading dose is equal to volume of distribution into plasma concentration, is it dependent on volume distribution? Yes. If the volume distribution is more, most of the drug will be gone to the tissues and you have to give a loading dose. If the required plasma concentration is more, then you also have to give a loading dose. Now once again, this is also IV. So higher the volume distribution, higher will be the loading dose. So is it dependent on volume distribution? Yes. Is it also dependent on the plasma concentration? Yes. So 1 and 3 तो correct है, 1 and 3 correct. Now look at this, 1 and 3 कहीं पे है, सिर्फ 1 and 3 कहीं पे नहीं है, right? Now we have 1 and 3 कहाँ पे, 1 and 3 is coming here and 1 and 3 is also here. Now 1 and 2 and 3. T half life का formula is totally different, that we will discuss subsequently. Remember this is by IV route. अगर हम any other route से देते हैं, then in this case scenario जो भी bio availability होगा that will be divided. So other route से देंगे तो loading dose is equal to volume of distribution into plasma concentration, and what is the bio availability? F here is equal to the bio availability. So it is inversely proportional to the bio availability. see, if the volume of distribution is very high, it is inversely proportional. It is inversely proportional to the bioavailability. ज़्यादा टिश्यूज में जा रहा है तो आपके ब्लड में कम रहेगा, राइट. Loading dose will be inversely proportional to F, that is bioavailability. If the volume distribution is high, loading dose will be required to achieve the therapeutic plasma concentration. Loading dose is equal to volume distribution to plasma concentration, and F here is equal to bioavailability. These screenshots I have taken from the notes that we usually teach in the classes. ठीक है. So inversely proportional है तो bioavailability is also one of them. So 1, 3 and 4. I think Manish was the one who said, and Preeti also said the correct. Shivam also said. Chris D'Souza also said correct answer. Excellent, all of you guys, that you have participated in this one, and most of you are actually saying correct. Chris is saying A. Sorry, Preeti. Chris has changed the answer later on. Okay, fine. So I hope all of you guys have got this one. This is very, very important question. Loading dose is equal to volume distribution to plasma concentration. Another question that was asked in one of the recent examination was the formula for the T half-life. T half-life is equal to a constant 0.693. T half-life is equal to T half-life का formula. It is directly proportional to volume distribution. Directly proportional to volume distribution. If there is a more volume distribution, the T half-life will automatically be high, because it is also said T half-life is directly proportional to volume distribution and inversely proportional to, that is another formula, K constant, that is another formula, Preeti, 0.693 divided by your K, that is the K constant, that is another formula that we have for T half-life. Volume distribution inversely proportional किसके होगा? Inversely proportional किसके होगा? Very simple. You just think like this. If the drug is getting out of the body more, they are having lesser T half-life, and if there is a slow going out of the body, there will be more T half-life. As simple as that, right? So going out more, that is going to be your clearance. Excellent, all of you, right? So that is another formula for the T half-life. So this question was also asked in the very recent, that was another exam question. I'll just show you that question also, the question on digoxin, where they give you the important values and they ask you to simply do the calculation. ठीक है. बाकी बायो अवेलेबिलिटी का भी फॉर्मूला विच यू ऑलरेडी नो, दैट ओनली रूट दैट इज हैविंग 100% बायोअवेलेबिलिटी इज IV route. So we always keep IV as our control. That means IV is the one that is always used for the comparison, right? So when we say bioavailability is going to be compared with the area under curve graph, area under curve oral divided by area under curve IV into 100. Area under curve oral by IV into 100, right? So this is about your bioavailability. In this question, remember 1, 3 and 4 are the correct one. We'll take the next one. Now this was also one of the questions that was asked in the May 2025. All these are May 2025. A 24-year-old sexually active male presents with the OPD department with the complaints of painful micturition, let's say dysuria, we call it as a thick yellow urethral discharge, okay, past 3 days. He denies fever, chills, flank pain. He reports multiple unprotected sexual encounters in the past month. ठीक है, भाई अपनी लाइफ जी रहा है अच्छे से. आई डोंट नो कहाँ पे है, इंडिया में तो नहीं है ऑफ कोर्स. A urethral swab is sent for the gram stain and shows इंट्रासेलुलर ग्राम नेगेटिव डिप्लोकोकाई. एंड नाउ ये वर्ड जो है ना, ये सेम वर्ड पे इमेज भी आ गया है, सेम इसी वर्ड पे इमेज भी आ गया है. लुक एट दिस, इंट्रासेलुलर ग्राम नेगेटिव, इंट्रासेलुलर ग्राम नेगेटिव डिप्लोकोकाई. ये सेम जो वर्ड दिया है ना, ये वर्ड बार बार आता है. कभी इसी का इमेज दे देते हैं, बोलते हैं क्या ड्रग ऑफ चॉइस है ना, विद द पॉलीमॉर्फोन्यूक्लियोसाइड. तो क्या लग रहा है? And the diagnosis was also confirmed with the nucleic acid amplification test. He was previously treated with penicillin, but the symptom persisted. You suspect antibiotic resistance. ठीक है, तो penicillin काम नहीं कर रहा है in this case scenario, which is also one of the first line drug in this condition, which start also with the G, right? Definitely, Dr. Chris, right? So what is the diagnosis? Can you tell me? Gram negative, the diagnosis is also starting with letter G, right? Most appropriate. All right, so this is mainly your gonococcal infection या gonorrhea infection, where the drug of choice is actually going to be your ceftriaxone. If it is not there, which was asked in the NEET PG, similar, then the oral drug for this, if they are going to ask, so you can also use another third generation cephalosporin that is called cefixime, that was asked in the recent 2024 examination. Same topic पे उसमें oral था, right? So gonorrhea के लिए you can always give ceftriaxone. Please remember the fact that ceftriaxone is a third generation cephalosporin, and this ceftriaxone is going to be utilized as a drug of choice, which I will give very quick, right? They are going to be utilized very commonly in following condition, which I say that Mahatma Gandhi ki CECT, right? Vanco is only effective against gram positive, yes, but this was gram negative, right? So this is going to be meningitis, so meningococcal infection, like let's say Listeria meningitis, gonococcal infection, community acquired pneumonia, E. coli, chancroid and typhoid fever. यहाँ पे it is the drug of choice, right? Ceftriaxone happens to be the drug of choice, Mahatma Gandhi की CECT. So you can always count on these topics. These are always high yield topics, और इससे क्वेश्चन हर एग्जामिनेशन में पूछे जाते हैं आपसे, राइट? नाउ अपकमिंग एग्जामिनेशन में एक क्वेश्चन मैं जो एक्सपेक्ट कर रहा हूँ वो ये कि नाउ फोर्थ एंड फिफ्थ जनरेशन इज वेरी मच इनटू डिस्कशन, राइट? पहले से ये ड्रग हैं, बट नाउ इट इज देयर वेरी मच इनटू डिस्कशन इन ऑल द CMEs एंड ऑल, जितने भी CMEs होते हैं एंड सिम्पोजियम जितने भी हो रहे हैं आजकल, उसमें बड़ा डिस्कशन उसका हो रहा है. So do remember, they will give you a patient with the history of MRSA infection, right? History of MRSA infection, and they will be asking you which of the following is the preferred agent. This is the potential MCQ, I'm telling you. अगर आता है तो purely coincidence है, okay? A patient with a history of MRSA infection, preferred agent, and you always would like to choose कि MRSA के लिए तो सर ने बोला था vancomycin, but believe me, vancomycin will not be in the option, right? So if vancomycin is not in the option, please do remember the drug of choice definitely is vancomycin. लेकिन मैंने क्या बोला कि vancomycin आपको ऑप्शन में मिलेगा ही नहीं. And none of the cephalosporin are effective against MRSA except the fifth generation cephalosporin. Fifth generation cephalosporin, right? The fifth generation cephalosporin is going to be your ceftaroline. Very good, Shivam. I think you got the essence here. Ceftaroline, which is the next potential MCQ, which will be seen, right? Ceftaroline, and next is going to be ceftobiprole. If any very good academically sound examiner gets a topic to make a question on your antibiotic, high chances that this topic will be covered, because all the speakers, those who are well connected in the different medical colleges of country, they are if there is any seminars and all, there is a discussion of MRSA infection and ICU based infection, and in that they are actually praising a lot about the fifth generation cephalosporin. So we can see this anytime, because इन्हीं सब बातों से सवाल निकल के आता है, ठीक है? चलिए, I hope all of you guys have got this one. So I think amoxicillin will not be utilized because it is one of the penicillin only, है ना? चलो, great. A 62-year-old male with a history of coronary heart disease and renal failure was admitted to the ICU patient with elevated blood pressure, okay, 190, 110. Declining urine output, okay, so he is already going towards hypertensive emergency case, right? The intensivist administered phenoldopam, okay, see, none of these questions are made by our team or me, it is the PYQ. So try to understand key what is the mindset of the examiner, okay? Phenoldopam intravenously is given. How does this drug help in improving the renal function? Please do remember, this drug that has been given to the patient is called your phenoldopam. Phenoldopam का एक ही इंडिकेशन है, they are one of the D1 agonist and dopamine receptors are present at the renal and mesenteric vasculature. Dopamine receptor is present at the renal and mesenteric vasculature. They are going to cause vasodilatation. So therefore they are going to prefer in a patient with the hypertensive emergency with renal failure. Hypertensive emergency with oliguria, not renal failure, sorry, oliguria. Hypertensive emergency with oliguria. Okay, if there is a patient presenting with a hypertensive emergency with oliguria, so in that case scenario they are going to be utilized. Okay, so D1 antagonist nahi, D1 agonist. Phenoldopam has no action on alpha 1 antagonism. However, alpha 1 antagonism could also help, because alpha 1 antagonist could also cause vasodilatation, but in this case scenario phenoldopam they have asked. So phenoldopam, remember, it's one of the D1 agonist. This question is one of the question from autonomic nervous system, phenoldopam, dobutamine, dopixamine, isoprenalin. Now upcoming exam question का इसी से एक और टॉपिक मैं एक्सपेक्ट करता हूँ, बिकॉज ये जो ड्रग जहाँ से ये उठाया गया वहीं पे एक और ड्रग का जिक्र होता है by the name of dobutamine. This is the only sympathomimetic drug that is having selective action at the beta 1. It is the only sympathomimetic having selective action of beta 1. They are the beta 1 agonist. They are considered the preferred drug for acute heart failure. They are preferred drug in acute congestive heart failure. Acute CHF, these are going to be the preferred drug. Dobutamine, preferred in acute congestive heart failure. Okay, plus they have multiple other uses, like for example if there is a shock without oliguria, वहाँ पे भी ये preferred drug होगा. Shock without oliguria में भी also they are going to be the preferred drug. In cardiogenic shock में भी also they will be preferred drug. Cardiogenic shock में भी also they are going to be the preferred drug, है ना. Cardiogenic shock, prefer acute congestive heart failure, shock with oliguria. Stress echocardiography में भी also they are going to be the preferred drug. Stress echocardiography, especially in some people, those who cannot walk on the treadmill, like morbid obese or diabetic foot ulcer, or if there is a person with history of amputated leg. ठीक है, dobutamine, do remember that. Okay, because मैं अपनी बात को ख़त्म कर रहा हूँ, थोड़ा एंथुजियाज्म मेरा हाई रहता है, बिकॉज कोई भी इस टॉपिक से क्वेश्चन है तो छूटना नहीं चाहिए. इसलिए एक और ड्रग है जो उसी जगह पे जिक्र है बुक में, उसी पेज पे, बाय द नेम ऑफ डोपिक्सामीन. डोपिक्सामीन इज वन ऑफ द D1, D2 एंड बीटा 2 एगोनिस्ट. सो इज इट वर्किंग ऑन dopamine receptor and beta receptor also? Yes, because dopixamine was asked in 2023 or 2024 INI. कैसे क्वेश्चन पूछा था कि which of the following drug is having action on the beta receptor, right? So dopixamine also have action on beta receptor. Do remember that dopixamine also have action on beta receptor. So they will also be causing vasodilatation. We can utilize them in hypertensive emergencies, or if we can utilize, if you want, let's say you have given a local anesthetic and you want a rapid abolishing of the action of the local anesthetic, you can give the vasodilatation that will be causing a local vasodilatation, जिसकी वजह से उसका immediate distribution हो जाएगा. ठीक है, तो डोपिक्सामिन इज ऑल्सो वन ऑफ द ड्रग दैट इज D1, D2 and beta 2 agonist. Among the given choices, remember, D is the correct one. D2 antagonist, these are the drugs that you must have seen, drugs like your haloperidol, droperidol, ये सारे के सारे हैं, है ना. haloperidol, droperidol, these are the D2 blockers, right? और D2 ब्लॉकर में एक और बड़ा फेमस सा ड्रग है जिसपे क्वेश्चन भी आता है आपका डोमपेरिडोन, मेटोक्लोप्रामाइड, domperidone, metoclopramide. Okay, alpha 1 antagonist, which you all know, like prazosin and all. So phenoldopam has no action at the alpha receptor. So I hope a lot of topic we have covered in this one. Which of the following drug is used to reverse the action of vacuronium? Vacuronium, rocuronium, what are they? They are the non-depolarizing muscle relaxant, right? They are non-depolarizing muscle relaxant, and whenever you want to give to reverse the action of non-depolarizing muscle relaxant, to reverse the action, like post-operatively you will try to reverse the action. For that you will be giving a drug that is called your neostigmine. You are going to give a drug by the name of neostigmine. Mind the fact, giving only neostigmine doesn't help. Neostigmine definitely you can give, that is reversing, but one drug that is also added with them, will also be your atropine. To mask the muscarinic side effect, atropine is also added. टू मास्क द मस्करनी, ठीक है, ओके। नाउ इसी में एक और क्वेश्चन है, जैसे मैं क्रिस डिसूजा बोल रहे जो बोले हैं मैं अभी वही बोलने जा रहा था। इसी में एक और क्वेश्चन है, दैट इज रॉक्यूरोनियम एंड वैक्यूरोनियम. Rocuronium, vacuronium, they are also the non-depolarizing muscle relaxant. For them, there is a specific chelator by the name of Sugamadex. बहुत ही सुगम ड्रग है Sugamadex. Now this is also one of the drug that is very commonly asked not only in the examination but also in the viva. कॉलेजेस में जब वाइवा वगैरह भी होता है ना सेकेंड ईयर वाले बच्चों का, तो उस समय भी एग्जामिनर जो यूजुअली इन सब कॉलेजेस से आते हैं, टॉप मेडिकल कॉलेजेस के आते हैं अगर, तो मैं देखता हूँ सुगामा डेक्स के बारे में दे यूज टू आस्क, मतलब वो क्वेश्चन ऐसे फ्रेम करते हैं कि सुगामा डेक्स बच्चे को आता है कि नहीं. तो व्हाट इज दिस सुगामा डेक्स? इट इज एक्चुअली कंसिडर्ड एज अ यू कैन से केमिकल एंटागोनिस्ट बिकॉज दे आर गोइंग टू चिलेट the rocuronium and vacuronium, chilate rocuronium vacuronium, inactivate, और इनका साथ तब तक नहीं छोड़ता जब तक they are kicked out of the body and facilitate their excretion, facilitate their excretion. तो this is also one of the other drug, this is also one of the other drugs Sugamadex, जो कि कभी भी आपके एग्जाम में आ सकता है. I mean पहले भी आ चुका है, do remember this, ठीक है. चलिए डेंट्रोलिन सोडियम, बाकी सारे ऑप्शन को भी देख लेते हैं ना. डेंट्रोलिन सोडियम, इट इज द ड्रग ऑफ चॉइस फॉर अ पेशेंट विद द मैलिग्नेंट हाइपरथर्मिया विच इज कॉमनली एसोसिएटेड विद ड्रग्स लाइक योर सक्सिनिलकोलिन. मैक्सिमम रिस्क एसोसिएटेड विद सक्सिनिलकोलिन. अदर दैट कैन कॉज दिस वन विल बी योर हैलोथेन, ठीक है, मैलिग्नेंट हाइपरथर्मिया, रिमेंबर दैट, उसके लिए ड्रग ऑफ चॉइस है आपका डेंट्रोलिन सोडियम. Baclofen is one of the GABA B agonist. Baclofen is a GABA B agonist. It is utilized as a centrally acting muscle relaxant. तो muscle relaxant के फॉर्म में इसको यूज करते हैं, ठीक है. They themselves will cause muscle relaxation. लेकिन वैक्यूरोनियम भी मसल रिलैक्सेशन कर रहा है, तो इसको रिवर्स करने के लिए, टू रिवर्स द वैक्यूरोनियम वी आर गिविंग नियोस्टिग्मिन और एट्रोपिन साथ में, ठीक है. एट्रोपिन इज नॉन सेलेक्टिव मस्कुलिनिक एंटागोनिस्ट, दे आर द एड-ऑन ड्रग, बट द प्रिफर्ड वन और आई वुड से सिंगल बेस्ड ड्रग इज नियोस्टिग्मिन, ओके. GABA B agonists, they themselves are a muscle relaxant. Alright, so other options also we have ruled out here. That is the beauty of attending these kind of session, because you get to understand not only the correct answer but also why others were not the one and what kind of upcoming question can be asked from these same topic. Which of the following drug match the following drug with their respective schedule under the Drug and Cosmetic Act 1940. एक जीरो छूट गया है. 1940. This Drug and Cosmetic Act 1940, this rule was implemented actually in around 45. So there are multiple schedules given. Remember that multiple schedule. मैं हमेशा बोलता हूँ that you remember like this. This schedule deals with the biological product, special product. This screenshot is taken from the notes that we always use. Insulin, antitoxin. So B for biological. Remember it is going to be Schedule C. This schedule gives the list of poisonous substances under Siddha, Unani, Ayurveda. So this will be, I mean the poisonous substances is going to be Schedule E. Regulation for running a blood bank which where everything is frozen. So that is going to be Schedule F. Details the drug labeled with caution or guideline not to be taken or not to be given except under medical supervision. Except under medical supervision. Except under medical supervision and prescription. Like for example, hormonal anti-cancer drug. So you do not infuse the hormonal anti-cancer drug at home. You should always give that in front of the oncologist. Okay. So this is going to be Schedule G. Sold by retail on a prescription of RMP. Who is RMP? Registered medical practitioner. So मैं बोलता हूँ हम सब हैं RMP. H for हम सब हैं RMP. Expiry period will be Schedule P. Schedule that deals with the generic drugs. Generic drugs worldwide have similar names. That is going to be Schedule W. Worldwide similar name is Schedule W. Then this is your all-time favorite psychotropic drug, and I always say the psycho X's are always psycho, and that is why they are X. right? Excess are always psycho and they also have high abuse potential. And specify the requirement and guideline for running the clinical trial, that will be coming under Y. And to check over unauthorized sale of antibiotic, that is going to be your H1. And you should also remember Y के बाद एक और है, यहाँ नीचे जगह नहीं है, I'll just write it down. No, we always discuss this and luckily in this time we got a question on this one, है ना. मेरे स्टूडेंट गॉट वेरी हैप्पी कि बिकॉज ये हमारे टॉपिक का पहला ही काफ़ी टॉपिक होता है हमारे रेगुलर क्लासेस का. So there is something also called the drug that actually deals with the, this drug actually deals with the veterinary drug. Veterinary drug से साथ जो शेड्यूल डील करता है, that is going to be schedule Z. And I say जब हम ABCD पढ़ते थे तो हम Z से क्या पढ़ते थे, Z for zebra, सबसे पहले वही नाम आता है, Z for zebra which is animal, that is Z, right? So do remember this, poisonous substances, whenever you eat anything it brings E from your mouth. E मतलब your expression become E, क्या खिला दिया. F for running blood bank, for running blood bank everything should be frozen. Guideline, right, guideline not to be given except under medical supervision. So G for guideline, sold by retail on a prescription of RMP, जो हम देंगे, हम सब हैं RMP. P for expiry period, very very easy. Worldwide same name will be for generic drugs worldwide. X, psycho was X and psycho is X. Why should I prescribe? So let's do clinical trials. Clinical trial Y. And Z for zebra, that is going to be veterinary drug. Now in our country India there is a rapid rise of the antibiotic resistance. To check over the unauthorized sale of antibiotic, schedule H1 has been brought into the existence. H1 has been brought into existence. Okay, now look at this. H1 को कैसे पहचानोगे? If you look at the drug strip here, remember in the H1 schedule on the left hand side there is going to be a red line. तो कभी भी नेक्स्ट टाइम जब आप एक एंटीबायोटिक खाइएगा तो उसके लेफ्ट साइड में देखिएगा क्या कोई ऐसा लाइन दिख रहा है क्या. अगर रेड लेफ्ट साइड में एक लाइन है मतलब दैट इज कमिंग अंडर शेड्यूल H1. दिस इज गोइंग टू कम अंडर शेड्यूल H1. What you are never going to forget that I told you, Z for zebra is a veterinary drug. तो B के सामने आ जाएगा 4, B के सामने आ जाएगा 4, B के सामने 4 कितने ऑप्शन के पास है? B is matched with the 4, only one option, that is correct answer. Now a question like this is always going to be very fun to solve because if you know 1 to 2 option, your question is high chances that it is going to be correct. Okay, morphine is having high abuse potential. So high abuse potential, ये excess का abuse high होता है, that is going to be C का 1. Okay, insulin and hepatitis B vaccine. So I think you can easily do hepatitis B vaccine A ka 3, that is under guideline only you will be giving, right? And then we have H, insulin, H insulin, that is going to be D ka U2, that is H, right? So do remember जो हम देंगे, बिकॉज हमको ही पता है कि कितने डोज में देना है, कैसे देना है. बिकॉज आई ऑलवेज रिमेंबर वेन एवर इट कम्स टू इंसुलिन दैट इफ़ यू आर गोइंग टू टेक इंसुलिन फ्रॉम अ क्वेक, तो यूजुअली क्या हुआ, देयर इज़ अ वेरी फेमस स्टोरी दैट आई ऑलवेज नरेट इन द क्लासेस ऑल्सो, दैट देयर वॉज अ टाइम व्हेन वन डॉक्टर एक्चुअली प्रिस्क्राइब इंसुलिन एंड ही सेड दैट टेक इंसुलिन 10 units morning, 10 units evening, and somehow this quack could not understand because the person has to inject, and the nurse who actually gave advice, she thought कि यार इंसुलिन लगाना तो सबको आता ही होगा, पेशेंट को भी आता होगा, एंड शी जस्ट सेड ओके इसमें से इतना लेकर के और 10 आपको लगाना है. क्या बोला? 10 आपको लगाना है. एंड ही वेंट, ही कुड नॉट अंडरस्टैंड कि भाई इंजेक्शन लगाना कैसे, बिकॉज ही वॉज नॉट टॉट, सम हाउ इट हैज़ हैपेंड, ही वॉज नॉट टॉट कि हाउ टू गिव सबक्यूटेनियस, बिकॉज सबको तो आता नहीं ना, ट्रेन करना पड़ता है. तो he took the medicine to a quack, and उसके पास ना कई सारे बॉटल्स थे, तो कई सारे बॉटल में ml वाइज तो कम ही रहता है ना, तो ही सेट कि इसको बता दीजिए कैसे लगाना है और आप ही लगा दीजिए. है ना, आप ही लगा दीजिए इसको कैसे लगाना है, आई डोंट नो हाउ टू यूज़ इट, राइट। तो क्वैक थॉट, ओके, क्वैक है, क्वैक मतलब झोला, है ना, उनको ज़्यादा आइडिया तो है नहीं, तो दे थॉट, ही थॉट दिस गाई हु हैपन्स टू बी well aware about how to give injection, how to give IV, he actually loaded the entire the entire drug, because he thought कि 10 का मतलब 10 ml, तो बोला कि 10 ml कैसे देंगे, इतना तोड़ना पड़ेगा, तो पहला ही उसने खोला और पूरा एक फिल करके 10 यूनिट्स देना था पूरा फिल करके, एंड देन ही गेव। तो डू रिमेंबर दैट इंसुलिन सिरिंज होते हुए भी ही थॉट कि नहीं इसमें तो नहीं आ पा रही, तो बड़ा छोटा है, तो ही कुड नॉट अंडरस्टैंड। तो अब कहाँ का क्वैक था वो एक जानकारी लेना पड़ेगा, लेकिन हाँ, दिस हैज़ हैपेंड इन द पास्ट, दैट डू रिमेंबर दैट इंसुलिन शुड बी गिवन बाय द डॉक्टर एंड शुड बी इंस्ट्रक्टेड कि भाई हाउ टू टेक, कितना ml लेना है, ठीक है। Nothing new, definitely it will happen, the PYQ series for FMG, that will also happen. So I hope all of you guys have got this one the correct answer here, ठीक है। Okay, which of the following statement about thalidomide is false? थैलिडोमाइड के बारे में इनमें से कौन सा है जो false है? It act as an anti-metabolites, anti-metabolite DNA synthesis inhibitor, they are not. They are teratogenic, yes, they are associated with a very famous teratogenic effect that is called phocomelia. It is used in the type 2 leper reaction, yes, and also can be utilized in the multiple myeloma, है ना, multiple myeloma में भी also. So we have thalidomide and there are other derivative like lenalidomide, pomalidomide that can also be utilized. They are not anti-metabolites. They are not anti-metabolites. Okay. Thalidomide, they are having multiple immunomodulatory action, angiogenesis inhibition, that is also one of the mechanism that they have, but they do not have anti-metabolitic action. Which of the following drug is associated with the cholestasis without significant portal inflammation? Isoniazid, acetaminophen, amoxicillin, clavulanic acid and estrogen. Okay, cholestasis is caused by many drugs, but without significant portal inflammation. This is a very direct question. Which drug is actually causing no portal inflammation, but there will be cholestasis? Isoniazid, acetaminophen. Acetaminophen definitely is one of the paracetamol. Paracetamol, it causes portal inflammation. Likewise, isoniazid also, amoxicillin, clavulanic acid is also hepatotoxic. Estrogen, can it cause cholestasis? Yes, but it do not cause portal inflammation. Remember that estrogen do not cause portal inflammation. Okay, they will not be causing this. Isoniazid की toxicity, that is also associated with the peripheral neuropathy, and to prevent this one we actually add vitamin B6. Acetaminophen की toxicity which is also called paracetamol, अगर इसका ओवरडोज हो जाए तो वी आर गोइंग टू गिव N-acetylcysteine. N-acetylcysteine, the best time to give N-acetylcysteine should be given best within the first, the best is as soon as possible within the first 8 hours. Okay, amoxicillin, clavulanic acid, they are the antibiotic with the broad spectrum penicillin and beta-lactamase inhibitor. ठीक है. Which of the following drugs are primarily used for clinical cure of malaria? Which of the following drugs are primarily used for clinical cure of the malaria? Can you check this question? Can you check this question and tell me what could be the possible answer? Which of the following drugs are primarily used for the clinical cure of the malaria? Okay, please tell me. Artemether, sulfadoxine, pyrimethamine, primaquine, chloroquine. clinical cure, radical cure. There is something also called radical cure. Remember that there is something also called radical cure, and radical cure के लिए remember which is required mainly for the vivax and oval. Vivax and oval के लिए radical cure चाहिए, and radical cure is mainly primaquine, or one of the derivative of the primaquine by the name of tefenoquine. आर्टिमीथर क्या हम क्लिनिकल क्योर के लिए यूज कर सकते हैं? क्लिनिकल क्योर का मतलब हुआ एरिथ्रोसिटिक शाइजोंटिसाइड, एरिथ्रोसिटिक शाइजोंटिसाइड. तो एनी ड्रग दैट इज वर्किंग एट द लेवल ऑफ आरबीसी, एट द लेवल ऑफ सर्कुलेशन, राइट, दे आर नोन एज एरिथ्रोसिटिक शाइजोंटिसाइड. ठीक है, आर्टिमीथर, सल्फाडॉक्सिन, पायरिमेथामिन, प्राइमाक्विन, क्लोरोक्विन. सो 1 2 का 4. द बेस्ट आंसर टू गो हियर इज 1 2 का 4, 1 2 का 4. ठीक है, 1 2 का 4 इज द बेस्ट वन. Okay. Now do remember, according to National Vector-Borne Disease Control Program, the policy for treatment of the malaria, if you are going to look at this, classification of anti-malarial drug on the basis of the clinical use, anti-malarial on the basis of clinical use. So one is called your radical cure. This direct question, I mean most of them we have covered in our classes. Radical cure, that is mainly required in the vivax and oval, and for that we use primaquine. 15 milligram on the daily basis primaquine will be required for 2 weeks. Or another drug by the name of tefenoquine, which is having a high volume of distribution. So tefenoquine will be required single dose on day 2. Single dose on day 2. This is actually going to be your radical cure. Next it is going to be clinical cure. Please remember, clinical cure that we know, it is mainly done because clinical symptom is going to come if the parasite is already in the RBC stage, right? So they are known as your erythrocytic schizonticide. Erythrocytic schizonticide. Now what are the erythrocytic schizonticide drugs? We have some drugs that are known as your slow acting erythrocytic schizonticide, and then there are some drugs that are known as your fast acting erythrocytic schizonticide. Slow acting and fast acting erythrocytic schizonticide. You see, in my classes I don't like to teach on PPT because मुझे लगता है कि पावर पॉइंट पे लर्निंग एंड टीचिंग बोथ बिकम स्लो. सब कुछ स्लो हो जाता है, आपके सोचने की क्षमता भी स्लो हो जाता है और आप सो जाते हो. स्लो सुला देता है. So that is going to be drugs like your proguanil, pyrimethamine, and tetracycline. टीबी, लेप्रोसी, मलेरिया से क्वेश्चन ना है ऐसा हो ही नहीं सकता. इन तीनों टॉपिक से क्वेश्चन डेफिनेटली रहता है आपके एग्जाम में. प्रोगवानिल, पायरिमेथामिन, टेट्रासाइक्लिन. एंड फास्ट एक्टिंग, इफ समवन इज टॉकिंग वेरी फास्ट, आप उनसे बोलिए भाई साहब मचल क्यों रहे हैं, क्यों मचल रहे हैं. मचलना मतलब बीइंग रेस्टलेस, मचलना मतलब बीइंग रेस्टलेस. दैट इज गोइंग टू बी मेफ्लोक्वीन, artemisinin. Currently artemisinin is the drug of choice for all the falciparum malaria. Then we have chloroquine, halofantrine, a very famous drug also associated with the QT prolongation. Atovaquone, lumefantrine, and quinine. Lumefantrine and quinine. Alright, so very easily you can remember MACHAL, मचल क्यों रहे हैं, why are you being restless. ठीक है. Another clinical use apart from the radical cure, another clinical use is we also use the antimalarial drug for the prophylaxis. So the third clinical use is going to be the prophylaxis. So prophylaxis के लिए depending on the short term or long term prophylaxis, we have doxycycline for the short term prophylaxis, short term prophylaxis less than 6 week, or we have mefloquine. So this is also one of the question, कब दोगे, है ना. तो mefloquine, it is mainly utilized for the long term prophylaxis if the person is traveling to malaria endemic area for few months. तो mefloquine months के लिए, few days कुछ दिनों के लिए doxycycline. So this doxycycline, it will be given 100 milligram daily basis 2 day prior से लेकर के till 4 week after. So after coming from the journey, 4 week after is same for all of them. Mefloquine 250 milligram on the weekly basis. The rule is the person has to consume 2 doses before the journey. So 250 milligram per week, that will be given 2 week prior to journey till 4 week after. 2 week prior till 4 week after, right? So this is actually going to be your different uses of the anti-malarial drug. So you have a radical cure, you have a clinical cure, and it is also utilized for the prophylaxis. It is also going to be utilized for the prophylaxis. I hope it is making sense to all of you guys. Okay. So among the given one, radical cure वाला एक ही था, that is primaquine. So clinical cure के लिए 1, 2 का 4. 1 artemether can be used, sulfadoxine pyrimethamine, yes. Sulfur pyrimethamine है, तो pyrimethamine is never used alone. They are also given, always given in combination with sulfadoxine. Together they become Cidal, है ना. And chloroquine तो है ही है हमारा, chloroquine here. That is one of the heme polymerase inhibitor. Alright. Next question is about which of the following is not used in the management of the postpartum hemorrhage. Postpartum hemorrhage के लिए कौन सा use नहीं करेंगे? Oxytocin. I think it's the drug of choice. Carboprost, PGF2 alpha analog, yes, they can also be utilized. They will also be causing contraction of the smooth muscle, but this one is going to be avoided in bronchial asthma patient. That was also one of the question in NEET PG. Dinoprostone is not used, cervical ripening के लिए use करते हैं. Dinoprostone used for the cervical ripening, PGE1 analog. Misoprostol can be utilized, yes, but dinoprostone cervical ripening के लिए use करते हैं. We do not use this for the postpartum hemorrhage. Which of the following statement is true regarding the pharmacological relation between imipramine and diphenhydramine? Imipramine and diphenhydramine. Imipramine, it is one of the tricyclic antidepressant, and diphenhydramine, it is one of the first generation antihistaminic drug. What is the pharmacological relation? TCA is also causing anticholinergic, and first generation antihistaminic are also having anticholinergic. So they both have anticholinergic property, and that explains the fact that why both of them are also having common kind of side effect. They both can cause common side effect. They both can cause common side effect like dryness of mouth, blurring of vision, constipation. All these are going to be the common side effect in both of them. Dryness of mouth, blurring of vision, constipation, urine retention. So this could be the next potential MCQ, right? They do not counter the action of each other, है ना. And norepinephrine reuptake inhibitor, no, they are not NARI, है ना. They are not NARI. Noradrenaline reuptake inhibitor is a different group of drug, है ना. Which of the following drug is most teratogenic and is strongly associated with the neutral tube defect? Among the given one, phenytoin, carbamazepine, valproate, and methotrexate. Remember, valproate, that we know it is the maximum teratogenic drug, maximum teratogenicity. Maximum teratogenicity, that will be causing the condition that is called spina bifida, right? Spina bifida. So whenever you look at the baby whose mother got exposed to the valproate, remember, there will be spina bifida where there is going to be exposed spinal cord with the tuft of hair, right? Exposed spinal cord with the tuft of hair. Okay, spina bifida. Others can also cause, like carbamazepine, they are also associated with the neural tube defect. Methotrexate can, there are antifolate drug can also cause neural tube defect. Phenytoin is causing fetal hydantoin syndrome, cleft lip and palate, all these. So these are going to be the next potential MCQ. Which of the following drug is causing cleft lip and palate, thin upper lip, short digits, all these are fetal hydantoin syndrome ka feature. Correct answer for this one is going to be C. right? There is a table here that is going to summarize important and teratogenic drug. I'll just give a quick summary. In the next 1 to 2 minutes you will have this. Phocomelia has been associated with a drug that is called thalidomide. Fetal warfarin syndrome, so again naam hi hai fetal warfarin syndrome, so there is going to be a drug called warfarin. Remember, in fetal warfarin syndrome the patient will have again skeletal and facial defect. इसका दूसरा नाम होता है कॉन्ट्राडी सिंड्रोम. फीटल वार्फरिन का दूसरा नाम क्या होता है? कॉन्ट्राडी सिंड्रोम. जस्ट होल्ड ऑन मिनट प्लीज, होल्ड ऑन मिनट. ऑलराइट, स्केलेटल फेशियल फ्लैट नोज भी कई बार वर्ड आ जाता है. फ्लैट नोज बिकॉज ऑफ द कार्टिलेजेस डिफेक्ट. fetal hydantoin syndrome, again that is going to be your phenytoin. All the characteristic feature like cleft lip and palate, thin upper lip, short digits, microcephaly. Neural tube defect, any other anti-epileptic drug can cause. Methotrexate can also cause. Aplasia cutis, that is associated with your drug. Scalp defect, that is associated with the drug that is called methimazole or carbimazole. Methimazole or carbimazole. Abstinence anomaly, lithium. Renal dysgenesis and growth abnormality, all the ACE inhibitor can cause this one. All the ARBs can also cause this teratogenic event. Dysgenesis and oligohydramnios, that can be caused by diuretics. Gray baby syndrome is a very famous side effect that is associated with the chloramphenicol, color कर देता है. Kernicterus yellow baby syndrome, that is going to be cotrimoxazole. So these teratogenic effect that I am writing here, one of which is very frequently asked in most of the examination. 1 to 2 question you always get from this one. Tendinitis and arthropathy associated with the fluoroquinolone, that is going to end with the floxacin, and they will always give you a history of a footballer. There is going to be history of, मैं आपको क्वेश्चन का लैंग्वेज बता दे रहा हूँ कैसे आया था. हिस्ट्री ऑफ अ फुटबॉलर. सो मैं क्या बोलता हूँ कि फुटबॉलर की हिस्ट्री में फुट वाला प्रॉब्लम आएगा तो फ्लोरोक्विनोलोन होगा, विच इज एंडिंग विद द फ्लोक्सासिन. फुटबॉलर की हिस्ट्री में लॉट ऑफ एफ वर्ड इज कमिंग. फुटबॉलर की हिस्ट्री में फुट वाला प्रॉब्लम. चॉप्स इज गोइंग टू बी एरिथ्रोमाइसिन, दैट इज कॉन्जेनाइटल हाइपरट्रॉफिक ऑब्स्ट्रक्टिव पाइलोरिक स्टेनोसिस, राइट. In a female child, that is going to be associated with your diethylstilbestrol. Mobius syndrome can be caused by misoprostol, where the patient will have abnormality with cranial of 6 and 7. Autotoxicity, nephrotoxicity. Which antibiotic can cause autotoxicity, nephrotoxicity? So the antibiotic that is going to cause autotoxicity and nephrotoxicity is going to be the antibiotic that is going to cause autotoxicity and nephrotoxicity. It is going to be aminoglycosides. The antibiotic that can cause will be your, this is erythromycin, I think. Diethylstilbestrol, I have told this as well. Mobius syndrome, misoprostol, this also we have covered. Abnormality with the cranial of 6 and 7. Aminoglycosides like capreomycin, kanamycin, streptomycin, like this kind of drug. Premature closure of ductus arteriosus, this last one that I am writing here. Premature closure of ductus arteriosus if there is NSAID exposure in the 3rd trimester. If there is excess of NSAID exposure in the 3rd trimester, they can lead to premature closure of ductus arteriosus. So this is one simple table which you can always download after the class, and you can always remember that 1 से 2 क्वेश्चन डेफिनेटली इससे आ जाते हैं आपके लिए. ठीक है. A 64-year-old man with hypertension, type 2 diabetes, presenting with a fatigue, exertional dyspnea, echo shows left ventricular hypertrophy. Okay, so this was the question, and this drug on which this question was asked is a very frequently asked drug in almost all the examination, NEET PG, FMG, INI CET. Left atrial enlargement, and it also shows hypertrophy, left atrial enlargement, and preserved ejection fraction. Okay, BNP level is also on the higher side. Despite optimal beta blocker and ACE inhibitor, he had 2 heart failure admission in the past. So see, the examiner is giving a lot of information in this question. Heart failure का case है, BNP is increased, व्हाट विल रिड्यूस द फ्यूचर हॉस्पिटलाइजेशन एंड इंप्रूव आउटकम, मतलब कौन इसकी मॉर्बिडिटी मोर्टालिटी दोनों को कम कर रहा है. अमंग द गिवन ऑन डिजॉक्सिन, इवाब्रेडिन. डिजॉक्सिन इज वन ऑफ द drug that can be utilized in heart failure, but these are not the drug that is going to actually reduce the shown condition or increase the improvise the mortality. Ivabradine is a funny current blocker. They are going to be utilized in angina. Loop diuretics can be utilized initially, but the correct answer for this one is going to be SGLT2, which is the favorite of the most examiner nowadays. SGLT2 inhibitor like canagliflozin, dapagliflozin, empagliflozin. Because this patient is having diabetes also, this will be the best drug for this one. So diabetes may, plus they are also having nephroprotective property, right? Congestive heart failure may, we can use them in many conditions, SGLT2 inhibitors. A 58-year-old man with a septic shock, he is febrile, tachycardic, okay. सेप्टिक शॉक का सबसे पहले आपको पता होना चाहिए कि व्हाट इज द ड्रग, प्रिफर्ड ड्रग, बिकॉज यहाँ पे हार्ट रेट इज इंक्रीज्ड, बॉडी टेम्परेचर इज इंक्रीज्ड. ब्लड प्रेशर, ही हैज अ ब्लड प्रेशर इज 80-50, he had a blood pressure of 80-50. Despite adequate fluid resuscitation and IV crystalloid, his urine output is low. Okay, so he is already in shock. Shock वाले patient में रहेगा ही ये सारे outcome. What is the next best step? Dopamine, norepinephrine, hydrocortisone, vasopressin. Now please do remember this. Urine output already कम है. If you give vasopressin, what will happen? There will be vasoconstriction. They will further deteriorate the problem. Dopamine is going to have action at the D1, beta 1 and alpha 1, right? D1, beta 1 and alpha 1. But in septic shock, they will increase the heart rate further. The patient itself is tachycardic. Norepinephrine has been associated with the reflex bradycardia. And norepinephrine के साथ एक और अच्छी बात यह है that these are the preferred drug in septic shock. Preferred drug in septic shock. ठीक है, norepinephrine. So you are going to administer what? Norepinephrine, preferred drug in septic shock. Okay. False regarding bempedoic acid. Bempedoic acid, remember guys, it's a new drug. They are the adenosine citrate, adenosine triphosphate citrate lyase inhibitor, ATP, adenosine triphosphate citrate lyase inhibitor. इसको बोलते हैं ACL इनिबिटर, ACL इनिबिटर, एडेनोसिन ट्राइफॉस्फेट सिट्रेट लाइज इनिबिटर, that is going to inhibit the cholesterol synthesis. So you have to find out a false. Can be used with the statins. Yes, they are very safe with the statin. They are the dicarboxylic acid. Now this question I am pretty sure, and I am accepting this fact that these structures and all we don't usually teach in the NEET PG classes, but in the MBBS classes it is taught. MBBS क्लास में जब होता है, जब इसका PPT बनता है, तो फर्स्ट लाइन ऑफ द गुडमैन गिलमैन बेम्पिडोइक एसिड का पहला लाइन जो बनता है वो गुडमैन गिलमैन से देखिए कैसे बनता है कि बेम्पिडोइक एसिड इज अ डाइकार्बोक्सिलिक एसिड, इज अ न्यू क्लास ऑफ कोलेस्ट्रॉल लोअरिंग ड्रग अप्रूव इन 2020. ठीक है, बेम्पिडोइक एसिड एजेटिमाइब कैन बी यूटिलाइज राइट टुगेदर. बेम्पिडोइक एसिड को स्टैटिन के साथ भी दे सकते हैं. इनफैक्ट बेम्पिडोइक एसिड इज ऑल्सो एप्लीकेशन इन पेशेंट हु आर स्टैटिन इंटॉलरेंट. अगर स्टैटिन टॉलरेट नहीं कर पा रहा है तो उसमें भी बेम्पिडोइक एसिड हम दे सकते हैं. ठीक है, रिमेंबर दैट. अनदर थिंग that bempedoic acid, if you look at this bempedoic acid, they are administered orally, and remember that they are a prodrug that is metabolized active compound. This all question, everything has been taken from the book. मैं बता रहा हूँ, देखिए bempedoic acid coenzyme A is a competitive inhibitor of ACL. They are the competitive inhibitor of adenosine triphosphate citrate lyase. They are the competitive inhibitor of this one. They are the competitive inhibitor. See, here it is saying non-competitive inhibitor. तो इतना फाइन लेवल पे जाकर भी कैन एग्जामिनर आस्क, yes, definitely INICET है, expect the unexpected. Now this type of question is very not the rank deciding, I would say, because Not everyone would be aware that this is going to be a case of this is a dicarboxylic acid, which is the structure, and can be used with statins for hypercholesterolemia, inhibit the cholesterol synthesis. Yes, they are a competitive inhibitor. So this image that I have shown you here is the image from the book, from the Goodman-Gilman. All right. They can be given in combination with the statins also, and if the patient is not tolerant to statin also, we can utilize. Okay, but they are competitive inhibitor. It's option C here, non-competitive, which is wrong. All of the following drugs are used in the treatment of acute mania except used in acute mania except. Now mania का acute mania का the drug of choice is lithium. ठीक है, तो क्या haloperidol यूज कर सकते हैं? Yes, they are the typical antipsychotics, or I would say D2 blocker. AP मतलब antipsychotics. Valproate is one of the also mood stabilizer. Rather, they are also the drug of choice in a patient with the rapid cycler. They are drug of choice in patient with the rapid cycler. Lithium and amitriptyline. Now do understand this important point here, that lithium can be utilized, but amitriptyline, it's one of the TCA, tricyclic antidepressant. It has no role in the acute mania, not for acute mania. In fact, mania में इसका कोई रोल नहीं है, right? So other drug can be utilized, like lithium can be utilized, the drug of choice. Other mood stabilizer can be utilized. So I always say, for the treatment of mania, lithium, which is a drug of choice. Other drug that can be utilized will be atypical antipsychotics, carbamazepine, topiramate, and valproate. So see, very easy mnemonic to remember, that for this mania, lithium ACT act well for valproate. For the mania, lithium act well. मैनिया के लिए लिथियम क्या करता है? वो बढ़िया से काम करता है. तो लिथियम एक्ट वेल, यस. लिथियम act atypical antipsychotics, carbamazepine, topiramate, and well will be valproate. Lithium act well, right? Amitriptyline has no. So this was the first paper that we have covered just now. Next is going to be November 2024. So you will realize on the basis of the previous paper you are able to solve many new questions. I mean other questions as well, because November के भी काफी सारे टॉपिक इनसे मिलते जुलते हैं, and likewise May 2024 के काफी टॉपिक मिलते होंगे. We'll see. In a patient with a history of fungal infection to nails and with diagnosis of onychomycosis, topical treatment that is used. So see, this question, similar kind of question, right? This similar kind of question is actually asked in FMG, previous FMG examination. But उसी समय I made this mnemonic also. I remember CC8. That is going to be canistan, cyclopyrox, efinaconazole, amorolfine, tavaborole. Tavaborole is a protein synthesis inhibitor, and terbinafine. Terbinafine is a drug of choice in onychomycosis. So among the given choices, tavaborole is the one. Now this type of question is very easy. They're not very easy, because किसका कौन सा preparation available, it is very difficult to say. But अगर आपने ये question पहले पुराने किए होंगे, then you will be able to easily mark this one, because on the basis of the previous question only I included this, what are the nail lacquer preparation available. So CC8 is the mnemonic that I made. I remember that this was asked in somewhere around 2022 है ना. 2022 में ये क्वेश्चन आया था. आई रिमेंबर इट. उस समय भी मैं यूट्यूब पे ये सेशन लिया था और ये आया था ये क्वेश्चन FMG में. What is the drug of choice for fasciola hepatica? Right? Fasciola hepatica के लिए, see, for all the platyhelminth, drug of choice for all the platyhelminth and flukes are going to be praziquantel, but not for fasciola hepatica. Liver fluke के लिए, fasciola hepatica, that is going to be a liver fluke. This is an exception to the rule. That is going to be triclabendazole. Triclabendazole is the exception to the rule here. Okay. Platyhelminth. They are drug of choice for all the nematodes. Okay. लाइक राउंड वर्म, पिन वर्म, वुक वर्म, जितने भी हैं. ड्रग ऑफ चॉइस इन ऑल केसेस ऑफ एमीबियासिस. Metronidazole. Among the given choices, triclopentazole is the correct answer for this question. Choose the correct option regarding phosphonatoid. Now again, this is also one of the question जो गुडमैन गिलमैन के डायरेक्ट लाइन बाय लाइन. तो हर एग्जामिनेशन में एक दो क्वेश्चन ऐसे होते हैं जो what the examiner does, they take the book, open one paragraph, and from that paragraph they will change a couple of things, a couple of information, and they'll make one question. I'll show you this question how it was asked from Goodman Gilman. And INI CET का ध्यान रखिएगा, फेवरेट बुक है, because this is not the first time I am taking a recall of INI. I have taken previously also 2020, 2021, 2022. जब से बनाए तब से रिकॉल नहीं रहे. INI CET जब से बनाए उसके पहले एम्स लेते थे अलग से. So I have been following very closely that pharma में whenever they ask question they always pick Goodman Gilman because line by line उसके words मिल जाते हैं वहाँ से. That's why in my notes also I prefer Goodman Gilman because notes के लिए भी जब मैं उसको refer करके बनाता हूँ तो most of the question we get lucky and we get to see also in the examination most of the topics. ठीक है. तो phosphonatoin is given to all seizure patient in ER irrespective of CNS effect and hypertension. You have to choose a correct option. देखते हैं what is phosphonatoin. It is a water soluble prodrug of, it is a water soluble prodrug. Okay, prodrug of phenytoin to all patient. Safe dose of phenytoin is 250. You will not be able to remember this, I'm pretty sure, है ना, कि 250 है या 150 है क्या है. High dose can cause cardiotoxicity in old people and nephrotoxicity in young people. Maximum oral dose causes cerebellar and vestibular symptom. High dose cause cerebellar toxicity. Read the information. ठीक है. Okay, let's read. When phosphonatoin is water soluble prodrug, ठीक है, देखिए ये आपके गुडमैन गिलमैन का ही है. दिस इज ऑल्सो गुडमैन गिलमैन 14th edition. ठीक है. Water soluble prodrug administered IV at an excessive rate in the emergency treatment of status epilepticus. In the treatment of status epilepticus, the most notable toxic signs are cardiac arrhythmias with or without hypertension and CNS depression. तो cardiac and CNS toxicity हो गया. Although cardiac toxicity occur more frequently in older people. See, कितना फाइन लाइन पे हो रहा है. द रीजन आई एम शोइंग यू दिस, यू हैव टू अंडरस्टैंड कि किस तरीके का एग्जामिनर बुक को यूज करके दे मेक द क्वेश्चन. कार्डियक टॉक्सिसिटी मोर फ्रिक्वेंटली इन ओल्डर पीपल, राइट, दोज विद द नोन कार्डियक डिजीज एंड इट ऑल्सो डेवलप इन यंग हेल्दी पेशेंट. तो कार्डियक टॉक्सिसिटी किस में ज्यादा हो रहा है? ओल्डर पीपल. यहां पे क्या बोला है? High dose can cause cardiotoxicity in older people and nephrotoxicity in young people. These complications can be minimized by administering phosphonatoin at a dose less than 150 milligram of the phenytoin. So maximum is not 250, maximum is not 250. Please remember, it's not 250 milligram. Do remember per minute. It is 150. All right. Acute oral dose results primarily in cerebellar and vestibular symptom. Acute oral doses से क्या हो सकता है? ये सारे के सारे ऑप्शंस हैं आपके एग्जाम में. Acute oral doses results primarily in cerebellar and vestibular symptom. High doses have been associated with the marked cerebral atrophy. Look at this. Look at the option D. Maximum oral dose can cause cerebellar and vestibular symptom, and high dose is causing cerebellar atrophy. So everything is taken from the from the books. तो इनमें से क्या क्या करेक्ट है? देखिए, क्या ये सही है? यस, दिस इज करेक्ट. दिस इज करेक्ट. हाई डोज कैन कॉज कार्डियोटॉक्सिसिटी इन ओल्ड पीपल, नेफ्रोटॉक्सिसिटी इन यंग. यस, दिस इज ऑल्सो करेक्ट. Phosphonatoin is given to seizure patient in ER irrespective of CNS side effect and hypertension. Okay, now this is something that we have to check it again. Aniket is saying उदय कुमार मेडिकल फार्माकोलॉजी. देखिए, अगर आपको समझ में आ रहा है उस बुक को एक बार लेके देख लीजिए. अगर समझ में आ रहा है देन डेफिनेटली यू कैन चूज दैट. आई फॉर MBBS स्टूडेंट आई यूजुअली से दैट यू कैन गो हैड आइदर विद द कैटजंग, और छोटा बुक चाहिए तो शर्मा इज ऑल्सो समथिंग दैट इज हैविंग प्रिटी लैंग्वेज दैट कैन बी अंडरस्टैंडेबल. ठीक है. Fosphenytoin, the water soluble administered IV at an excessive rate in the emergency treatment of the status epilepticus. The most notable toxic signs are cardiac arrhythmia with or without hypertension. Although cardiac toxicity occurring more commonly in this one, right? It can also cause the problem in this one. Dose related problem भी होगा, CNS effect, behavioral changes, increase, right? Gingival hyperplasia, ये सारे साइड इफेक्ट हैं इनके. This also have been asked in the recent FMG examination. Gingival hyperplasia. Now this was one of the multi correct answer actually, है ना, जैसे INICET में आता है multi correct answer वाला. Fosphenytoin is given to all seizure patient in ER irrespective of CNS side effect and hypertension. Now this is a very important thing. How can you give this irrespective of the CNS side effect and hypertension? They themselves can cause arrhythmia. तो अगर already आपको दिख रहा है कि CNS depression में या arrhythmia का history है, then in that case scenario you will not be giving, because these are the very notable toxic signs, right? So you do not give irrespective of this. तो what is the correct option में होगा 1, 2 are correct, 1, 3, 4 are correct, 3 and 4 are correct. So C and D are correct. C and D are correct. ठीक है, इस क्वेश्चन में क्या होगा? C and D are correct. देखिए, आई वुड नॉट, एनी टीचर, अगर आप पैन इंडिया कहीं पे भी चले जाएं, राइट, पैन इंडिया कहीं पे भी आप जाएं, किसी भी टीचर से अगर आप बात करते हैं, so do remember this, nobody will be suggesting you anything except the textbook, and after textbook the class notes. So वो class notes जो आपके मेडिकल कॉलेज में अगर आपको पढ़ाया जा रहा है, आपको समझ में आ रहा है तो वो, और नहीं तो जो प्रोफ 2 में जो क्लास नोट्स हम लोग देते हैं हमारे निश्चय बैच में वो, राइट. तो आइदर ऑफ देम, दोनों में से किसी एक में आप, दोनों में से किसी एक पे आप ट्रस्ट करें. बाकी किसी चीज़ों, बाकी तो बहुत सारी चीज़ें हैं, है ना, बहुत सारी चीज़ें हैं जो आप यूज़ कर सकते हैं. टोटली अप टू यू. स्टूडेंट को तो हमेशा फॉलो करना चाहिए जो टीचर बोल रहे हैं. बाकी अगर आपको उससे फ़ायदा हो रहा है, आप जो भी रिसोर्सेज यूज़ कर रहे हैं, तो इट्स योर कॉल देयर, है ना. इन दिस केस सिनेरियो C and D आर करेक्ट. मैं हमेशा रिकमेंड करता हूँ कि अगर आपने प्रॉफ में जो निश्चय बैच में हमने जो क्लास लिया है, अगर आपने उसको फॉलो कर लिया, बिकॉज इट्स सेम लाइक मेडिकल कॉलेजेस, एंड वी गिव अ वेरी डिटेल डिस्क्रिप्शन एंड वेरी स्लो पैटर्न में, अराउंड वी टेक अराउंड 45 to 46 क्लासेस पूरे साल में होती है. धीरे धीरे 2-2 घंटे की क्लास होती है, हफ्ते में 2 दिन. तो आपका वो ऐसा नोट्स बन जाता है कि आपके सारे प्रॉफ एग्जामिनेशन के लिए हो जाते हैं. एंड मैंने देखा है कि जितने बच्चे उसको रिलीजियसली फॉलो करते हैं, मोस्ट ऑफ देम दे गेट डिस्टिंक्शन इन देयर एग्जामिनेशन. ठीक है, ऑल राइट. विच ऑफ द फॉलोइंग स्टेटमेंट इज फॉल्स अबाउट thiopentone sodium? It is lipid soluble. Of course, highly lipid soluble. Thiopentone sodium is going to be highly lipid soluble drug. ठीक है. Redistributed to the adipose tissue and muscle. Yes, of course. That is why they have a short duration of action. Maximum concentration in brain immediately, because they are highly lipid soluble. The maximum concentration definitely will be in the brain. It has low duration of action because maximally excreted by the kidney. It has low duration of action because low duration of action because they are rapidly getting redistributed. They are rapidly getting redistributed, इसीलिए इनका लो डिस्ट्रीब्यूशन ऑफ एक्शन, लो ड्यूरेशन ऑफ एक्शन होता है. तो करेक्ट आंसर फॉर दिस वन इज गोइंग टू बी फॉल्स. इट हैज लो ड्यूरेशन ऑफ एक्शन बिकॉज मैक्सिमली एक्सटेड बाय द किडनी, नो, रैपिडली गेटिंग रिडिस्ट्रीब्यूटेड टू द मोर बल्की टिश्यूज. ठीक है. नाउ दिस वाज अ क्वेश्चन 46 kg. आई रिमेंबर, एक अगर आप रिकॉल देखोगे तो रिकॉल में द स्टूडेंट्स ऑन दैट डे दे सेड कि 46 ईयर की फीमेल थी. तो उसमें जब ईयर बदल गया तो आई मीन केजी बदल गया तो द आंसर विल ऑल्सो चेंज. बट व्हेन इट वाज आस्क्ड टू मेनी स्टूडेंट दे सेड नहीं सर 46 वेट था, 46 kg फीमेल वाज ऑन डिजॉक्सिन. द वॉल्यूम डिस्ट्रीब्यूशन इज गिवन 6 लीटर पर kg. द क्लियरेंस इज ऑल्सो गिवन. तो व्हाट इज द ड्रग गिवन? दैट इज गोइंग टू बी डिजॉक्सिन. प्लीज टेल मी द करेक्ट आंसर, बिकॉज ये PYQ है, कहीं ना कहीं आपने इसको जरूर देखा होगा. आई एम प्रीटी श्योर. वॉल्यूम डिस्ट्रीब्यूशन दैट हैज बीन गिवन is going to be 6 liter per kg, and how many kilos he eat? So that is 46. So 6 into 46, 6 into 46, 6 liter into 46 कितना हो जाएगा? 6 into 46. Anyone can solve this for me? Let's immediately solve it. That is going to be 276 liter. 276 liter. That is good. ठीक है. And then clearance has been given, that is going to be 4.6 liter per hour. Calculate the half-life. What was the formula for half-life? T half-life is equal to 0.693 into volume distribution and clearance. So simply put the value in the in the formula. तो 0.693 को आप ले सकते हैं 0.7 into वॉल्यूम डिस्ट्रीब्यूशन कितना है 276 इंटू 0.7. इफ यू आर गोइंग टू सी दैट इज गोइंग टू 193. 276 डिवाइडेड बाई 4.6. So that is coming somewhere around 42. So exactly that is going to be 42 hour. That is going to be 42, है ना. तो ये यूजुअली एक क्वेश्चन ऐसा था. एंड सच में भी डिजॉक्सिन का जो हाफ लाइफ होता है वो अराउंड 40 आवर्स ही होता है. इन रियल सेंस ऑल्सो व्हेन यू रीड द डिजॉक्सिन का फार्माकोकाइनेटिक प्रॉपर्टी दैट टी हाफ लाइफ अराउंड 40. सो दिस टाइप ऑफ क्वेश्चन हैज ऑल्सो बीन आस्क्ड इन द एग्जामिनेशन एज आई टोल्ड यू इन द वेरी बिगिनिंग टुडे. ठीक है, सेम थिंग यहाँ पे मैंने सॉल्व कर दिया था जस्ट टू मेक श्योर यू डू नॉट गेट कंफ्यूज. Which of the following drug is not given in uncomplicated malaria? See, इस साल भी like previously also I told you, this time also I'm telling you. ठीक है. अनिकेत टीका says teacher suggests KDT but it has such strange English which makes reading headache. तो इसीलिए तो मैंने बोला ना बच्चा कि एक बार ट्राई करिए. देखिए आपको किसकी बात समझ में आ रही है इससे फ़र्क पड़ता है. आप ब्रांड पे मत जाइए, मैं बता रहा हूँ, आप ब्रांड पे मत जाइए. आप उसमें जाइए कि आपको कौन समझा पा रहा है. अगर आपको एक दिन वॉल्यूम डिस्ट्रीब्यूशन पढ़ना है ना, तो आप ये ब्रांड पे मत जाइए कि ये अमेरिकन ब्रांड है और ये जर्मन ब्रांड है. आप ये देखिए कि कौन आपको समझा पा रहा है. अगर कोई पर्टिकुलर बुक आपको बात समझा पा रही है, गो विद दैट. अगर आपको KDT समझा पा रहा है या कोई भी बुक समझा पा रहा है, गो विद दैट. विच एवर बुक इज कन्वीनियंट. आई मीन 2-3 ही एग्जाम्पल मैं देता हूँ, या तो कैटसन देख लो और इंडियन में KDT और शर्मा. मतलब इतना इससे ज़्यादा टाइम होता नहीं बिकॉज आपको क्लासेस भी करनी है. और इसके अलावा मैं जो स्ट्रांगली रिकमेंड करता हूँ कि निश्चय बैच का जो क्लास नोट्स है आप एक बार लेकर देखिए. अगर आप सेकेंड ईयर MBBS स्टूडेंट हैं तो एक बार लेकर देखिए, आप लाइफ में कभी रिग्रेट नहीं करेंगे. पैथो फार्मा माइक्रो के जो नोट्स हैं, ठीक है. और अगर आपने रिलीजियसली पढ़ लिया तो डिस्टिंक्शन नहीं है, ऐसा हो ही नहीं सकता, ये मेरी गारंटी है. ठीक है, अगर आपने पढ़ लिया तो. विच ऑफ द फॉलोइंग ड्रग इज नॉट गिवन इन अनकॉम्प्लिकेटेड. नाउ दिस इज द क्वेश्चन दैट वाज वेरी वेरी अनयूजुअल काइंड ऑफ. नॉट uncomplicated. According to what I have heard from our seniors कि double negatives should be avoided. मैं बार बार इसको चेक किया कि भाई जब गाइडलाइन ये बोलता है और सीनियर्स बोलते हैं कि डबल नेगेटिव्स को हमेशा अवॉइड किया जाता है, तो यहाँ डबल नेगेटिव्स एक तरह से है नॉट गिवन इन अनकॉम्प्लिकेटेड मलेरिया. दैट मीन्स दे आर आस्किंग कि क्या प्राइमाक्विन अनकॉम्प्लिकेटेड में दे सकते हैं. अनकॉम्प्लिकेटेड मलेरिया जो मैंने आपको ऑलरेडी मलेरिया का गाइडलाइन पढ़ा रखा है. यस. क्या क्लोरोक्विन दे सकते हैं, क्या सल्फाटॉक्सिन पायरिमेथामिन दे सकते हैं. यस. IVRT सुनेट इट इज अ ड्रग ऑफ चॉइस फॉर कॉम्प्लिकेटेड मलेरिया. इट इज अ ड्रग ऑफ चॉइस फॉर कॉम्प्लिकेटेड और सेरेब्रल मलेरिया. सो सी दिस टाइप ऑफ क्वेश्चन इज देयर, नॉट गिवन. ठीक है. मैच द फॉलोइंग रिसेप्टर विद द हार्मोन्स. सो यू हार्मोन्स और न्यूरोट्रांसमीटर. See, you can call this one as a physio question, medicine question, pharma question. It doesn't matter. What matters is when you read this kind of topic, you should be able to solve this one. तो ये जो क्वेश्चन आया हुआ था यूजुअली आपको मैच करना था. तो ये मान लीजिए, अगर मान लीजिए 1 2 3 4 है, सो दिस इज गोइंग टू बी A B C and D. Nuclear receptor. Nuclear receptor is mainly which of the following is acting by the nuclear receptor? Thyroid, acetylcholine, इंसुलिन, ग्रोथ हार्मोन. इसमें तो जो सबसे आसान है, जो सभी को पता है, दैट इज गोइंग टू बी योर थायराइड हार्मोन या एस्टाइलकोलिन. एस्टाइलकोलिन इज गोइंग टू एक्ट बाय आइदर निकोटिनिक रिसेप्टर और मस्करिनिक रिसेप्टर. निकोटिनिक और मस्करिनिक, N और M. सो रिमेंबर एस्टाइलकोलिन, निकोटिनिक और मस्करिनिक, दे विल बी एक्टिंग बाय द आयन चैनल, राइट. आयन चैनल. तो आई थिंक ये मैं ऑलरेडी मैच करके दे रखा है. यू हैड टू जस्ट मैच इट. मैंने मैच करके दे रखा है ना. टायरोसिन काइनेस, इंसुलिन, एंड जैकस्टेट पाथवे, ग्रोथ हार्मोन, एंड न्यूक्लियर रिसेप्टर थायराइड. सो आई हैव जस्ट पुट इट इन अ करेक्ट ऑर्डर इटसेल्फ. बट रिमेंबर दिस क्वेश्चन वाज आल्सो आस्क्ड जहाँ पे आपको सिर्फ मैच करना होता था. जैसे आयन चैनल को मैं बोलता हूँ कि दे आर द फास्टेस्ट एक्टिंग रिसेप्टर. They are the fastest acting receptor and put their name in the Guinness Book of World Record. Put their name where? In the Guinness Book of World Record. So that is going to be GABA, especially GABA A and GABA C. Nicotinic receptor. See, nicotinic क्या है? It's one of the acetylcholine receptor. Nicotinic receptor like NN, NM, then NMDA receptor, and also your 5-HT3, right? Tyrosine kinase. Look at this here. Tyrosine kinase. We have insulin or insulin like growth factor 1. Insulin or insulin like growth factor 1. So we have insulin like growth factor 1, tyrosine kinase. Then we have Janus kinase in growth hormones and other cytokines. Janus kinase, growth hormone, other cytokines. So we have covered this all in much detail also in the classes, right? Which are the following? So what you understood from this question is that the topic of receptors are always going to be important, and next potential MCQ will be about your G protein coupled receptor. तो read about this one, है ना? अगर ये question आता है तो महज एक इत्तेफाक होगा, right? तो this is based on the basis of the experience कि किस तरह का examiner का mindset है. इस बार ये पूछा तो आगे क्या पूछ सकता है, right? उसी के basis पे है ये, ठीक है? Which of the following anti-epileptic drug modulate voltage-gated sodium channel and enhances the slow inactivation? Okay, so we have open state of, right, sodium channel, open, inactive, and then they become close, and then they go back again to the open. ये ऐसे जाता है. अब बोला है स्लो इनएक्टिवेशन, मतलब इनएक्टिव स्टेज में लंबे समय तक रहेगा basically. So there is only one drug, and I have been teaching this from last many exams, that do remember this, that the only drug that we know is going to be lacosamide, Lakme wala cream, because they are also having, it also has CRMP protein inhibiting property. It also has CRMP protein inhibiting property. Although how CRMP is actually producing, some research says that CRMP promote neuronal excitotoxicity, and when you block it, they will be having reduce in the excitotoxicity. But Goodman-Gilman says how CRMP is actually producing anti-epileptic action, that is unclear. But research papers में इनके different तरीके दिए गए हैं basically, है ना? So slow inactivation of voltage-gated sodium channel, that is going to be your lacosamide. Others are also working like lamotrigine. They are also blocking the voltage-gated sodium channel. Topiramate and phenytoin also blocking the voltage-gated sodium channel. But among the given choices, it's going to be lacosamide, Lakme wala cream. Lacosamide, again Goodman-Gilman का line है, it's the first anti-seizure drug to enhance the slow inactivation of voltage-gated sodium channel. देख रहे हैं, ये लाइन ही उठा के ऑप्शन में डाल दिया, क्वेश्चन में डाल दिया. अब इस लाइन को अगर आप फॉलो नहीं किए होगे या आपने क्लास नहीं किया होगा, यू विल नॉट बी एबल टू सॉल्व दिस वन, बिकॉज आपके नोट्स जो बनाए जाते हैं सेकंड प्रोफाइल, वो मेनली यही से उठा के बनाए जाते हैं. स्लो इनएक्टिवेशन ऑफ वोल्टेज-गेटेड सोडियम चैनल, स्लो इनएक्टिवेशन ऑफ वोल्टेज-गेटेड सोडियम चैनल, ठीक है? चलो, Which of the following drug act by binding with the CD4 cell receptor? तो recently CD4 cell receptor के लिए एक न्यू ड्रग आया जिसका नाम है इबालीजुमाब. CD4 cell receptor, it's a monoclonal antibody, humanized monoclonal antibody. ठीक है, remember that. Maraviroc, they are going to be the entry inhibitor of the virus. Maraviroc, that is going to be your CCR5 inhibitor. Fosemprenavir, they are the protease inhibitor, HIV protease inhibitor. Dolutegravir, that is going to be the integrase inhibitor. Okay. Ibalizumab, they are the CD4 cell receptor inhibitor. Ibalizumab, that's a new drug actually. Which of the following can lead to fall in the diastolic blood pressure? Multiple choice correct. Okay. So see, diastolic blood pressure is dependent on what all factor? Again, autonomic nervous system से alpha 1 beta 2. Try to understand very simple concept. और इसको इतना simplify कर दूंगा कि अभी खुद ही आप जवाब दे दोगे. Alpha 1 causes vasoconstriction, therefore they will increase the diastolic blood pressure. Beta 2 they cause vasodilation, therefore they will decrease the diastolic blood pressure. Question पूछ रहा है maximum fall or decrement in the diastolic blood pressure. तो can alpha blocker cause fall in the diastolic blood pressure? Yes. Can a beta 2 agonist cause a fall in the diastolic blood pressure? यस, राइट। नाउ सिंपैथेटिक फ्लो फ्रॉम द लंबर रीजन कम हो गया, तो अगेन आपका सिंपैथेटिक फ्लो कम, राइट, लेसर सिंपैथेटिक फ्लो, जिसके वजह से आपका डायस्टोलिक ब्लड प्रेशर कम होगा, बिकॉज सिंपैथेटिक फ्लो की वजह से ही वेसल का टोन मेंटेन्ड है. सो दैट इज गोइंग टू बी ऑल्सो लॉस ऑफ सिंपैथेटिक आउटफ्लो. Javed is saying 2 and 3. Why not loss of sympathetic outflow? Think about one. What will happen if there is a decrease or loss of sympathetic outflow, especially when you give lumbar puncture? High lumbar जब देते हैं तो क्या होता है, sympathetic outflow कम हो जाता है ना. तो उसमें फिनाइलेफ्रिन हम ड्रग देते हैं कि नहीं, नॉरएपिनेफ्रिन ड्रग देते हैं, जिसको हम न्यूरोजेनिक शॉक बोलते हैं. लॉस ऑफ सिंपैथेटिक लंबर रीजन, इसको न्यूरोजेनिक शॉक बोलते हैं. तो क्या इसमें बीपी फॉल नहीं करेगा? Beta 1 agonist can increase the heart rate. They will have no effect on the diastolic blood pressure. Alpha blockade, yes. Alpha blockade, yes. अभी मैंने बता दिया अल्फा ब्लॉकेड. बीटा 2 एंटागोनिस्ट नहीं, बीटा 2 एगोनिस्ट होगा. तो द करेक्ट आंसर इज गोइंग टू बी 1 and 3. Correct answer is going to be 1 and 3. 1 and 3 is going to be the correct one. Is it making sense to all of you, Javed and other students? Correct answer is going to be 1 and 3. 1 and 3. Now this question is also repeatedly being asked, same as it is उठा करके, कभी एरो को इधर लगाते हैं, कभी एरो को उधर लगाते हैं. So in this image they have put the circle here at GAT1, और GAT1 is the GABA transporter के लिए, GABA transportation के लिए, and the drug that is going to work is called your tiagabine, right? GAT1 inhibitor will be your tiagabine, GAT1 inhibitor. Retigabine, it's a potassium channel opener, other name is called izogabine. Ganoxolone, they are the GABAergic drug. They are the GABAergic drug, they promote the GABA release. GABAergic drug, they promote the GABA release. And ganoxolone, they have got their approval for infantile spasm, which is the next potential MCQ, which I always say, infant गाना गाता है alone. कौन गाना गाता है alone? Infant गाना गाता है alone. Do remember that. Infant always make their own song. Valproate is one of the drug that is going to work where I'll show you. There is something called GABA transaminase and succinic semialdehyde dehydrogenase. So this enzyme and this GABA transaminase both will be inhibited by this, both enzyme will be inhibited by valproate. अगर सिर्फ GABA transaminase पूछेगा, so remember only and only GABA transaminase inhibitor will be vigabatrin. If their examiner is going to ask you GABA transaminase inhibitor, then the answer will be vigabatrin. But look at the question what I am asking. GABA transaminase plus succinic semialdehyde dehydrogenase, सक्सिनिक सेमीएल्डिहाइड एसएसए, सक्सिनिक सेमीएल्डिहाइड डिहाइड्रोजेनेज, इन दोनों को इनहिबिट करने के लिए जो ड्रग है दैट इज गोइंग टू बी वाल्प्रोवेट. सी, तो वाल्प्रोवेट इज हैविंग आल्सो गाबार्जिक प्रॉपर्टी, गाबार्जिक एक्शन इज आल्सो देयर विद द वाल्प्रोवेट. ठीक है. एंटीडोट मार्क करेक्टली, कौन सा एंटीडोट करेक्टली मार्क किया गया? बेंजोडायजेपिन, फ्लूमाजेनिल, बारबिटूरेट. देखिए बारबिटूरेट के लिए तो कोई एंटीडोट है ही नहीं. बारबिटूरेट के लिए रादर आई शुड से यू शुड डू forced alkaline diuresis. Forced alkaline diuresis using soda bicarbonate और कार्बोनिक एनहाइड्रेज इनहिबिटर. एट्रोपिन के लिए वी कैन यूज फाइसो, नॉट कार्निटीन. डिजॉक्सिन के लिए फ्यूरोसमाइड, नो. डिजॉक्सिन के लिए वी कैन यूज डिजिबाइंड. रादर फ्यूरोसमाइड कैन बी कॉजिंग हाइपोकैलेमिया, and any drug that is causing hypokalemia, it will increase the risk of digoxin toxicity. It will increase the risk of digoxin toxicity. तो furosemide तो digoxin toxicity के रिस्क को बढ़ा देता है, like furosemide, loop diuretics, thiazide diuretics. तो एक ही करेक्ट मैच है, बाकी सारे तो रॉन्ग मैच दिख रहे हैं. ठीक है, अदर्स आर रॉन्ग मैच. लेट अस क्विकली समराइज इंपॉर्टेंट एंटीडोट. लाइक आयरन पॉइजनिंग का क्वेश्चन बार बार आता है, तो we can utilize the drug that is called your deferoxamine. If the patient is coming to you in the emergency, you can utilize the drug that is called your deferoxamine. इंजेक्टेबल रूट से इमरजेंसी में आप दे सकते हो. ठीक है. देन ओरल आयरन चिलेटर, स्पेशली इन अ पेशेंट दोज वर ऑन प्रोलॉन्ग ब्लड ट्रांसफ्यूजन और क्रोनिक ब्लड ट्रांसफ्यूजन, वी कैन यूज द ड्रग लाइक योर डेफेरिप्रोन, डेफेरासिरॉक्स, डेफेरिप्रोन, एंड अदर वन इज कॉल्ड योर डेफेरासिरॉक्स. That is oral iron chelator. Copper के लिए we can utilize the drug that is called your D-penicillamine. Lead के लिए we can utilize BAL, EDTA. Organophosphate carbamate के लिए we will be using the drug atropine, but for atropine we are going to give physostigmine, that is the reversible acetylcholine esterase inhibitor. Beta blocker के लिए we are going to give something called a glucagon. Benzodiazepine benzflumazenil, मजे देने वाला होता है बेंज. Digoxin digibind. Okay, morphine naloxone, that was asked many times in the recent examination. Paracetamol N-acetylcysteine. Methanol और एथिलीन ग्लाइकोल, जो अभी केस भी हुआ था, एथिलीन ग्लाइकोल जो डाइएथिलीन ग्लाइकोल, जो कफ सिरप वाला मध्य प्रदेश वाला जो केस हुआ था, छिंदवाड़ा डिस्ट्रिक्ट. मेथनॉल और एथिलीन ग्लाइकोल. ओके, मेथनॉल और एथिलीन ग्लाइकोल, इसके लिए हम क्या यूज़ करेंगे? हमारे पास द एजेंट दैट वी हैव इज कॉल्ड योर फोमेपिजोल. फोमेपिजोल, राइट? फॉर्म में पीता जा, दैट इज वन ऑफ द एल्कोहल डिहाइड्रोजनेज इनहिबिटर. Alcohol dehydrogenase inhibitor. So this is one of the summary of the important antidotes that is recurrently being asked in these examinations. ठीक है? JAK-STAT pathway approved for ulcerative colitis in patient with intolerant to TNF alpha. So TNF alpha drug is going to be drugs like your infliximab, certolizumab and all. So which one is the JAK-STAT pathway? तो tofacitinib, baricitinib. तो इसमें एक ही है tofacitinib. Erinumab, तो it is one of the erinumab is the CGRP inhibitor that is utilized for the prophylaxis of migraine. Ustekinumab is one of the interleukin 12 and 23 inhibitor. We can also utilize them in inflammatory bowel disease, but they are not the JAK-STAT pathway inhibitor. Tofacitinib, baricitinib is one of the baricitinib, right? They are the JAK-STAT pathway inhibitor. So this was also a direct and simple question. This type of question is expected in INI CET, especially अगर ये question बना हुआ है तो I know that I mean, क्योंकि पहले PGI चंडीगढ़ अलग होता था ना, तो I know from that experience कि this type of question is mostly from PGI चंडीगढ़ group of examiner, because ये उनका favorite language है, ये वाला चीज़ है, ये सारे के सारे जो है ना PGI चंडीगढ़, because PARP and all it's mainly asked in PGI चंडीगढ़, because PGI चंडीगढ़ के भी एग्जामिनर, एम्स के एग्जामिनर और जिपमर के एग्जामिनर एक साथ आ गए हैं, तो दिस इज PGI चंडीगढ़ का मोस्ट लाइकली, इट कुड बी एनीथिंग बट मोस्ट लाइकली, है ना. तो PARP इनहिबिटर यूज इन ब्रेस्ट कैंसर, तो PARP जितने भी होते हैं दे आर ऑल गोइंग टू एंड विद द पेरिब, ओला पेरिब, रूका पेरिब, नीरा पेरिब, है ना. ओला वाला रुक नहीं रहा, पेरिब, ओला पेरिब, रूका पेरिब, नीरा पेरिब. Palbociclib, they are the CDK, cyclin independent 4 and 6 inhibitor. Bortezomib, zombie, they are the proteasome inhibitor. We have covered this all in much detail, proteasome inhibitor, है ना. Vemurafenib, nipa wala, right? Nipa, tyrosine kinase inhibitor, that will be utilized. Vemurafenib, है ना. Vemurafenib is a tyrosine kinase inhibitor. This is the drug of choice in a patient with the multiple myeloma, right? Multiple myeloma. Palbociclib, right? Palbociclib, cyclin dependent kinase. Ribociclib, abemaciclib, है ना. They are going to be utilized in the breast cancer, right? This can be utilized in the melanoma. So in all this condition we can utilize these drugs. Okay, PARP inhibitor used in breast cancer, that is rucaparib. Next, match the following antidotes. See, same exam में अगर एक और आ गया तो I think you can easily solve this one. Match smoking के लिए we will be using varenicline, that is going to be 2. Opioid के लिए naloxone, that is going to be 1. Delirium tremens, so we will be using short acting benzodiazepine, because Korsakoff psychosis से अगर बचना है तो we will be using lorazepam, diazepam, oxazepam here, so that is going to be 3. Acute alcoholism, for decreasing the craving behavior, for decreasing the craving you can use this one. So see, अब इसमें ऑप्शन जो भी है, if you know already these important antidotes, you will be able to mark this very easily. A patient with history of MI on statins, MI का history है, he is on statins, that is one of the HMG co-reductase inhibitor. Aspirin, that is one of the COX-1 inhibitor, and metoprolol, that is a cardio-selective beta blocker. His lipid profile is HDL, ठीक है. ट्राइग्लिसराइड अगेन लेस देन 150 है तो ठीक है, बट कोलेस्टेरॉल इज हाई. What will be added to the present regimen? Please be careful while choosing. Gemfibrozil. What is gemfibrozil? It is one of the PPAR alpha agonist. I say fibrozil, fibrates, fibrates. So they are actually going to increase the level of lipoprotein lipase, which will be increasing the triglyceride ka breakdown. But do you actually want to do the triglyceride ka breakdown? The answer is no, because triglyceride to normal है, triglyceride absolutely fine, less than 150, right? It's absolutely fine. तो जेम फाइब्रोजिल तो नहीं यूज करेंगे, तो मतलब जिस भी ऑप्शन में 1 है उसको नहीं देंगे, उसको सेलेक्ट नहीं कर सकते हैं, 2 ऑप्शन रूल आउट हो गए. नाउ एजेटिमाइब क्या है? व्हाट टाइप ऑफ ड्रग इज एजेटिमाइब? आई से दे आर वेरी इजी पीजी ड्रग. These are the NPC1L1 inhibitor that inhibit the cholesterol absorption. They can also be added in addition to statins. Statins साथ इनको दिया जा सकता है. They are very easy peasy drug. बेम्पिडोइक एसिड का क्वेश्चन भी पिछले एग्जाम में आया था. ACL एडेनोसिन ट्राइफॉस्फेट सिट्रेट, एडेनोसिन ट्राइफॉस्फेट सिट्रेट लाइज इनहिबिटर, that can be added as an alternative to statins. ठीक है. कोलेसेवलाम क्या है? कोलेसेवलाम इज वन ऑफ द बाइल एसिड सिक्वेस्ट्रेंट. दिस इज ACL इनहिबिटर. दिस इज कॉल्ड BAS, बाइल एसिड सिक्वेस्ट्रेंट्स, बाइल एसिड सिक्वेस्ट्रेंट. तो कोलेसेवलाम कैन ऑल्सो बी गिवन. तो अगर मल्टीपल करेक्ट आंसर सेलेक्ट करना है तो हिज लिमिट फॉर डिजीज विट विल बी एडेड टू द प्रेजेंट. क्या ऐड कर सकते हैं? तो देखिए तीनों तो नहीं ऐड करेंगे, कोई एक ऐड करेंगे, राइट? लेकिन क्या मतलब हम इनमें से कोई कर सकते हैं? यस. तो ezetimibe can be added. Bempedoic acid can also be added. Bempedoic acid is a very good alternative to statins that can be added. And colesevelam, that is 4, that can also be added. So I think I'll go ahead with the 2, 3, 4 here. I'll go with the 2, 3, 4 as rightly mentioned by Dr. Rukmini also. 2, 3, 4 is the correct answer for this one. ठीक है? Now the last paper for the day is going to be May 2024. See. विच ऑफ द फॉलोइंग एंटी डिस्लिपिडेमिक. तो देखिए हर एग्जाम में एंटी डिस्लिपिडेमिक आ रहा है, तो मतलब एंटी डिस्लिपिडेमिक नवंबर में भी एग्जामिनेशन में क्वेश्चन रहेगा, है ना? इंक्लिसिरान वगैरह पे क्वेश्चन रहेगा. विच ऑफ द फॉलोइंग एक्ट बाय डिक्रीजिंग द LDL कोलेस्ट्रॉल बाय इनहिबिटिंग PCSK9. PCSK9, do remember pro-protein convertase subtilisin caxin type 9. They actually promote LDL receptor का degradation. They do not allow the reuse of LDL receptor. There will be no reuse of LDL receptor. So what we do now, we are going to give our patient PCSK9 inhibitor. That is going to be Ali. My friend Ali is evolved into a PCS. My friend Ali is evolved into a PCS. So I say alirocumab, a monoclonal antibody, fully human monoclonal antibody, evolocumab, and inclisiran, right? They inhibit the synthesis of this protein PCSK9. They inhibit the synthesis of the protein PCSK9. So PCSK9 inhibitor, all of them are going to be Ali is evolved into a PCS. Among the given choices, see same type of क्वेश्चन कैसे एग्जामिनर पूछ रहा है. ठीक है, अगर टाइम होता तो मैं आपके लिए और भी 23 का 22 वाले भी हम करते, बट अगर 22-23 का भी देखोगे तो ऑलमोस्ट इसी के आसपास रहेगा. लोमिटापाइड इज वन ऑफ द MTP इनहिबिटर. एजेटिमाइब, नियमेनपिक लाइक 1 इनहिबिटर. इवोलोक्यूमाब इज द वन. बेम्पिडोइक एसिड इज ACL इनहिबिटर, एडेनोसिन ट्राइफॉस्फेट सिट्रेट लाइज इनहिबिटर, बेम्पिडोइक एसिड. ठीक है, करेक्ट आंसर फॉर दिस वन इज गोइंग टू बी C, वेरी इजीली. All of the following is HER1 inhibitor except. Now there is HER1, इसी का दूसरा नाम होता है EGFR, epithelial growth factor receptor inhibitor, except because there is something called HER2 also. तो HER2 का दूसरा नाम होता है new, HER2 new. तो HER2 new inhibitor will be margetuximab, जो कि गुडमैन गिलमैन में ऑलरेडी इंक्लूड हो गया है बुक, राइट? margetuximab, pertuzumab, and trastuzumab. Earlier we had only trastuzumab, then we had pertuzumab, and now we have margetuximab. Now HER2 new positive breast cancer अगर है, if there is a HER2 new positive breast cancer, then we can use this drug, that is HER2 new blocker. अगर HER2 new वाला हर वाला ब्रेस्ट हो गया, हर वाला ब्रेस्ट कैंसर हो गया, देन इन दैट केस मैं बोलता हूं कि माजी पर ट्रस्ट करिए. किस पे ट्रस्ट करना है? माजी पर ट्रस्ट. माजी पर मतलब मार्जीटुक्सिमाब, राइट. पर विल बी परटुजुमाब एंड ट्रस्ट विल बी ट्रास्टुजुमाब. माजी पर ट्रस्ट है ना, माजी पर ट्रस्ट करिए. तो pertuzumab is the one. Cetuximab definitely, nesitumab and panitumab, they are all EGFR inhibitor or HER1 inhibitor. So this is a table here: cetuximab, nesituximab, and nesitumumab, panitumumab. They are the HER1 or EGFR inhibitor, right? Like cetuximab, SIR or head and neck cancer, squamous cell non-small cell lung cancer, colorectal carcinoma, panitumumab. ठीक है. HER2 new positive breast cancer, Margi per test. So expect the next potential MCQ from Margetuximab in the recent examination. Okay. Which of the following anti-leprosy agent causes skin pigmentation? See, skin pigmentation in the TB और leprosy drug में mainly 3 ड्रग होते हैं. एक होता है आपका रिफाम्पिसिन, राइट, रिफाम्पिसिन. एक होता है पैरा अमाइनो सैलिसिलिक एसिड, और एक कलर कर देता है क्लोफेजिमिन. नाउ क्या इन तीनों में से कोई है? यस, गो. Now the question is, which of the following anti-leprosy can cause skin pigmentation? Rifampicin जो pigmentation करता है, that is going to be body secretion, right? Body secretion and eye discoloration. PAS can also lead to body secretion, retinal pigmentation. Clofazimine can also lead to skin pigmentation. Clofazimine वो भी कर सकता है, skin pigmentation भी कर सकता है. ठीक है, so clofazimine will be the correct answer. This ofloxacin is one of the fluoroquinolone. They are utilized mainly in the resistant leprosy, and they are fluoroquinolone, so definitely they will be causing fluoroquinolone वाला side effect जो मैंने बता चुका हूँ कि fluoroquinolone फुटबॉलर में फुट वाला प्रॉब्लम. Patient with tenacious whitish productive cough management. Now this was a very tricky one. Dextromethorphan, that is one of the non-opioid agent that actually suppresses the medullary cuff center. Now whenever you give this one, always do remember, जब भी आप medullary cuff center को suppress कर दोगे तो removal of this productive cough will be uneasy. So wherever there is a dextromethorphan, you shouldn't use this in this condition. So you use mucolytic agent, or you can also use drugs that can increase the secretion. So among the given choices, we should go ahead with the bromhexine. That is one of the mucolytic agent. Ambroxol, bromhexine, and carbocysteine. Or secretion enhancer will be sodium citrate, potassium iodide, ammonium chloride, and guaifenesin. So guaifenesin can also be utilized. Guaifenesin very commonly utilized. Guaifenesin. So correct answer for this one will be B, mucolytic. A patient presented with the shortness of breath on lying down. Evaluation shows BP 160/100. Ejection fraction is 50% of the normal. Okay, that is lesser. Altered echo texture, portal vein mildly dilated. HbA1c level is also high, that is 7.8. Which of the following should be the preferred management? Now, this topic that I am telling you here, that diabetic patient with a cardiac involvement, that is the question they are asking. So, did they ask a similar question on SGLT2 inhibitor in your 2025 May? Yes. Did they also ask in November 2024? Yes, and this is the May 2024, so they also the same thing. That is one of the SGLT2 inhibitor, best drug for diabetes, and especially with the cardiac and chronic in a patient with a congestive heart failure, that is going to be SGLT2 inhibitor. Okay. In a patient with the enterococcal infective endocarditis who is allergic to penicillin, which of the following is the preferred management? Enterococcal infective endocarditis. Okay. Now allergic to penicillin. If he is allergic to penicillin, that means there is a case of beta-lactam allergy. ही इज नॉट रेजिस्टेंट. अगर रेजिस्टेंट होता तो द स्टोरी विल बी डिफरेंट. ही इज एलर्जिक. सो बीटा लैक्टम एलर्जी अगर है, दैट मीन्स ही विल बी एलर्जिक टू अदर बीटा लैक्टम्स ऑल्सो. Like for example, piperacillin is one of the beta lactams, that is penicillin. Ceftriaxone is also one of the beta lactam. Aztreonam, these are not effective for ग्राम पॉजिटिव एंड एनेरोब्स. ये साफ साफ बोलता है कि मैं ग्राम पॉजिटिव और एनेरोब्स की तरफ पलट के भी नहीं देखूंगा. आई विल नॉट लुक इवन राइट इवन वंस एट द ग्राम पॉजिटिव एंड एनेरोब्स. ठीक है. The correct answer is going to be vancomycin for this condition. Remember, enterococcal infective endocarditis, the most common cause is Enterococcus faecalis. The first line therapy should be MPs plus Genta, ampicillin plus gentamicin. Ampicillin is one of the beta lactam, that is penicillin, and gentamicin synergistic combination. But the problem is we cannot use ampicillin because this is a penicillin allergic patient. So in a penicillin allergic patient, the next best choice that is going to be utilized for Enterococcus faecalis will be your vancomycin. Vancomycin will be the next best choice. Now this is the question from your examination. Which anticoagulant needs monitoring? Fondaparinux, that is going to be ultra low molecular weight heparin. Ultra low molecular weight heparin that target 10A only. Dabigatran, they are the direct 2A inhibitor, direct thrombin antagonist. Enoxaparin, they are also the low molecular weight heparin. They target 10A, but they will also be having 2A inhibiting property. Unfractionated heparin, they follow zero order kinetics. They follow zero order kinetics, and any drug that follows zero order kinetics will have high risk of toxicity, and therefore unfractionated heparin should not be utilized. I mean, unfractionated heparin require monitoring, and इसकी monitoring करने के लिए you will be doing APTT. If there is any overdose of this one, bleeding will be the outcome, and overdose में के bleeding अगर हो गई तो bleeding में you are going to give the drug that is called your protamine sulfate. The drug that you are going to use will be called your protamine sulfate. ठीक है. Which of the following is false about voriconazole? Voriconazole is one of the azole that is an antifungal drug. It's an antifungal drug. It should be taken empty stomach. Yes. Loading dose should be given. Yes. Therapeutic drug monitoring should also be done with the voriconazole. But why would you add with the pyrazinamide? This is one of the TB drug. It is one of the TB drug. It should not. It should be combined. No, it should not be combined. There is no point of adding voriconazole with the TB drug. Now look at this again. Another question from the book. Book का line देखिए. The therapeutic drug monitoring is frequently used with the target serum concentration of 1 to 5. 1 to 5 के बीच में ही रखना है. ठीक है. To maximize the efficacy and to minimize the adverse effect. तो therapeutic drug monitoring तो करना ही है. ठीक है. Especially in the children. Monitoring is especially more important in children who are unpredictable plasma level of, who are at high risk of toxicity. All right. तो आई थिंक थेराप्यूटिक ड्रग मॉनिटरिंग करना, ये बात तो हो गया. लोडिंग डोज शुड बी गिवन. यस. ट्रीटमेंट शुड बी इनिशिएटेड. लुक एट दिस विद IV infusion of 6 mg per kg every 12 hours for 2 doses followed by 3 to 4. तो पहले आप 6 दे रहे हो followed by 3 to 4. That is going to be loading dose followed by the maintenance dose. ठीक है. Maintenance dose. तो loading dose भी दे रहे हैं हम लोग. Alright, there is no point of adding this with the pyrazinamide. और क्या ऑप्शन में है? It should be given empty stomach. Okay. Voriconazole available in 50 or 200 milligram tablet or suspension by hydrated. Not the suspension contain lactose because high fat will reduce. Look at this. Voriconazole bioavailability. Oral drug should be given either 1 hour before or after the meals. Can you look at this? Check this. तो ये सारे क्वेश्चन जो मैंने बताया अभी आपको, ये जो ऑप्शन यहाँ सेलेक्ट किए जाते हैं, दे आर डायरेक्टली फ्रॉम द लाइंस ऑफ द टेक्स्ट बुक. कितने ड्रग का बायोअवेलेबिलिटी आपको याद रहेगा, कितने ड्रग का TDM आपको याद रहेगा, राइट. सो दिस टाइप ऑफ क्वेश्चन एक्चुअली इज वेरी कॉमनली आस्क इन योर एग्जामिनेशन ऑफ INICET. तो 1 से 2 क्वेश्चन ऐसे रहते हैं जो एकदम बुक के पैराग्राफ से उठा के रहते हैं, और तीनों एग्जामिनेशन मैंने एक एक ऐसे क्वेश्चन दिखा दिए हैं. कैनाबिनोइड्स आर नॉट गिवन इन विच ऑफ द फॉलोइंग कंडीशन. रेट सिंड्रोम में इसका अप्रूवल नहीं है. रेट सिंड्रोम के लिए एक न्यू ड्रग आया है बाय द नेम ऑफ ट्रोफिनेटाइड. this is a new drug, but Lennox-Gastaut syndrome, tuberous sclerosis, Dravet syndrome, yes, इसके लिए कैनाबिनोइड हैज बीन FDA अप्रूव. Lennox-Gastaut syndrome का ड्रग ऑफ चॉइस पूछेगा तो यू कैन चूज वैल्प्रोएट, सोडियम वैल्प्रोएट. Dravet syndrome likewise, valproate being the drug of choice. Tuberous sclerosis में we can utilize vigabatrin, right? साथ में ACTH हम दे सकते हैं, ठीक. Tuberous sclerosis में infantile spasm. Which of the following is known side effect of intermittent? Teriparatide, abaloparatide. Which of the following is a known side effect of intermittent teriparatide? Teriparatide, abaloparatide, they are the recombinant parathyroid hormone analog. Not in the human model, but in animal model, they have shown to have osteosarcoma. This jaw necrosis has been associated with bisphosphonate. They have been associated with bisphosphonate, like for example, risedronate, any drug that is going to end with the dronate, etidronate, risedronate, bisphosphonate. Okay. They have also been associated with another drug that is called your denosumab, a monoclonal antibody, which is one of the rank ligand inhibitor. उनके साथ भी है. But in animal model, osteosarcoma has been reported with the teriparatide. Again, experimental चीजें INICET में आपके पूछा हुआ है. देखिए, antidiabetic drug causing unexplained persistent diarrhea. तो only drug that can cause unexplained persistent diarrhea will be metformin. ठीक है. Sitagliptins can cause upper respiratory tract infection. Pioglitazone, it can actually cause weight gain. It can cause macular edema, sodium and water retention, का retention. Okay. Glimepiride, they will be causing hypoglycemia, very very common. Hypoglycemia, bone marrow suppression, but unexplained persistent diarrhea has been reported with the metformin. Which of the following antidiabetic drug causes UTI? Again, another question from the same topic, that is going to be SGLT2 inhibitor, because the most common side effect will be UTI because they are causing loss of glucose. So dapagliflozin is the correct one. Metformin can cause megaloblastic anemia. Pramlintide, they can lead to hypoglycemia. Pramlintide can also lead to pancreatitis, and they can increase the risk of MCT, that is medullary carcinoma of thyroid. ठीक है. Gliptins are again URTI, upper respiratory tract infection or the nasopharyngitis. और आप सभी को मेटफॉर्मिन का पता ही है, they can cause lactic acidosis as a side effect, peripheral neuropathy, megaloblastic anemia, because they are reducing the vitamin B12 uptake. Dapagliflozin is the correct answer for this one. Alright, so we are about to finish 2-3 more questions. A diabetic patient with symptom of heart failure like dyspnea, which of the following anti-diabetic drug preferred? Again, एक ही टॉपिक पे से एक ही एग्जाम में कितने सारे क्वेश्चन आए हुए हैं. हार्ट फेलियर लाइक सिम्टम इन डायबिटीज, द आंसर द क्वेश्चन विल बी नन अदर देन योर SGLT2 inhibitor. Okay, empagliflozin. Which of the following is correct regarding diuretic and its site of action? So again, this is correct. Carbonic anhydrase PCT पे काम करता है. Yes. Thiazide diuretic, they work at the early part of DCT, distal convoluted tubule. Mannitol at all site, but especially at loop of Henle and PCT. Spironolactone, they will be acting at the collecting duct. The only correct answer is going to be carbonic anhydrase. So they are also asking same kind of question, that they give a history of a patient going to the mountain having breathlessness, and they ask a drug was given, what is the site of action? So PCT पे arrow लगा हुआ था या loop of Henle पे. So इससे पता क्या चलता है कि when they are asking this kind of question कि mindset of examiner is almost same for any of these examinations, because इन सारे examination का boss एक ही है ना, similar kind of body is there. Which of the following agent is rapidly reverses the effect of rocuronium? That I have already told you. Sugamadex, rocuronium, and vacuronium के लिए you can utilize Sugamadex, that is a chemical antagonist. In the previous question I have already explained you this one. ठीक है. Inhalational nitric oxide, they can be utilized in the management of the pulmonary hypertension, not in the intracranial or erectile dysfunction. Remember that erectile dysfunction का drug of choice is going to be your फॉस्फोडेस्ट्रेज 5 इनहिबिटर, आपका फेवरेट ब्लू पिल दैट इज कॉल्ड योर सिल्डेनाफिल, और सिल्डेनाफिल को कभी भी नाइट्रेट के साथ नहीं देते हैं, रिमेंबर दैट, राइट. So this one is about sildenafil is going to be contraindicated with the nitrates. That is the last question. ठीक है. So we have covered more or less around 60 questions we have covered today from the past 3 examination of INI CET. This is just to sensitize you the pattern of question that is actually being asked in the examination like INI CET, NEET PG, right? So keep revising, keep learning, and for more such videos you can always refer to other video lectures that we have. And since INI CET is very close, you can also watch the rapid revision video which is there in the pwmeded app, right? So to optimize your learning best, refer always to the pwmeded. And I can assure you that the pharma will be your best subject in the entire 19 subject of the medical science. Thank you very much to all of you guys. I hope that you have enjoyed. I will see you in my upcoming classes, and when you do a little bit of search, YouTube is full of resources. You can find more videos that may help you in the upcoming examination. Bye bye to all of you guys. Have a good night.